Hello, 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 my friends. Whoa, whoa, oh, okay. You never know when the computer starts flickering. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. It is Sunday, July 19th, and it is time for another IC support group meeting. IC, bladder pain, pelvic pain, prostatitis, anything below the waist that might be hurting, we are willing to talk about it because seriously, listen. If you got wicked IC, here's the deal. You're not sleeping through the night. You might be getting up every 15 minutes. You might have urgency, sudden moments where you just need to find a restroom because it hurts so bad. It's really weird. I mean, think about it. Like, we're not supposed to be able to feel, our bladders or our prostates. We're not supposed to feel intense pain down there. When there's intense pain down there, there is a problem. Hi, Julianne. Hello, Donna. It's nice to see you. And so it's very surreal when you have an injury below the waist. Number one, it's uncomfortable to talk about it, right? It's not like you're going to go volunteer. Hey, guess what? I have a prostate injury, or I have a bladder injury, or I've got it's uncomfortable. It's socially awkward. It's not something that people talk about regularly, right? And this is why so many people feel isolated, because here you are, you're suffering in silence at home alone, right? This is rough. And then I think that the part of it, hello, Debbie from hot Wisconsin. I think the other part about it too is that, there are all sorts of kind of old perceptions out there. There are perceptions, number one, that as you get older, you're just going to have more problems. True. Or that sex is always supposed to be painful, which certainly is true. Or that, you're kind of doomed to suffer. Let's say you started in childhood and you've had these for years, and you might be thinking that there's no hope. And that's absolutely not true. We are learning so much more about why pelvic pain occurs, how different structures contribute to that pain. And we're getting so much better now at working on doing the correct diagnostic workup so that you don't waste years on antibiotics, right? Think about it. If you were diagnosed with frequency, urgency, pressure pain years ago, the odds are you were probably put on antibiotics for years, a decade, longer. And some of you actually, anytime you started having issues, you just started taking antibiotics. There was a very, very important and meaningful research study that showed, it was a study of 50 women who had, quote unquote, taken antibiotics for years because they always thought that they had infection. And the doctor told them they had infection. But then when they went back and they went through their charts, guess what? Only 1 out of 50 had infection. One. The rest had other issues going on. And so it's important that you expand your horizons. As we have learned, we now know that quite a few patients could have a fungal infection rather than a bacterial infection. Some of you might have viral infections of the polyoma BK virus or the polyoma JC virus. If you have hundreds of lesions, that's quite suggestive of perhaps a viral infection. But far more of you have muscle injuries, that your symptoms began after some sort of pelvic trauma. And so it's an exciting time, unlike 20 years ago, 30 years ago, 40 years ago, where you were just given antibiotics and urethral dilations. Now, patients are getting cured. Depending upon your subtype, there is a chance that you can be cured. As an example, if your bladder symptoms are because you have fibroid tumors pressing on your bladder, we know that when the fibroid is addressed and fixed, that 70% of those patients are now symptom-free. We know that if you have pelvic congestion syndrome, you've got that feeling like you're carrying a bowling ball around at the end of the day. We know that these patients that their urinary symptoms can be dramatically improved when the pelvic congestion syndrome is fixed, and it is easily fixed with some very simple procedures. And so, this is a very, very good time. I mean, it sucks that you're in pain. It sucks that we're where we are right now in the world anyway. But we're going to get through this. We're going to get through this together. We are. I promise you. Myself, my name is Jill Osborne. I'm the president and founder of the Network. I am your national IC support group leader. I'm the longest serving IC support group leader in the nation, very close to being in the world. Actually, I think the only group that's ahead of me might be the German ICA with respect to doing live meetings. I bring to you 3 college degrees. I got a degree in chemistry, a degree in pharmacology, drug development, a master's degree in psychology, and I was on my way for a PhD in psychology when my IC hit. I have a presidential fellowship from the White House too. And so I really want you to understand that I really do my job with great seriousness. I study IC every day. A lot of what you're going to hear is going to be things that maybe even your local urologist might not know about, like subtyping. I also served on the U.S. Army IC research panel for many years, where we allocated millions of dollars of research for IC research studies. And so I've had the chance to work with the rising urology stars. I've had the chance to look at their scope and topics of interest. One of my jobs on that committee was to ground researchers because, when you're a researcher, research is exciting. I mean, it is. Hey, man, I know it sounds weird, especially if you've never been in a lab and you don't understand what that whole thing is, but they're solving mysteries. They're learning things that have never been learned before about how the human body behaves. I mean, think about urination. Just the whole process of urination is fascinating. How the bladder expands is fascinating. But there's a whole biochemical cascade that triggers a lot of these things that they're trying to understand. So they get really caught up in the research. They get excited by it. My job was to ground them and say, you know what? Listen, man, I know you love that, but I got patients over here in pain. So we got to really focus on them first, right? Donna says, you are one of the best. Thank you. Thank you very much, hon. Hi, Becky. Hello, Shannon. Shannon says, so guys, we are simulcasting right now on Facebook and YouTube. We will also be starting a Zoom meeting in an hour and 15 minutes for anybody who wants to drop in and ask questions, et cetera, et cetera. And hold on a sec. Alrighty then. So normally the way I do these meetings is I usually have about 30 minutes of an educational thing that I like to do. I like to improve our knowledge and all that sort of good stuff in here on the computer. And then we usually drop right into your questions. And so I really do have that I want to do today, right? So if you've attended my meetings before, then you know that we talk about the core fundamental subtypes of IC, the variants of IC, from Hunter's lesions to bladder injury to muscle injury to nerve injury to inheritance, et cetera, et cetera. And what have I always said, almost every single meeting, is that there are more subtypes to be defined, but that there is one subtype that, in my opinion, is really, really important here, and that is a hormone-driven subtype. Because as a support group leader, I will tell you, I have worked with patients for years and years, 27 years and counting, who clearly believed that their symptoms were driven by hormonal variations. And once they got their hormones stabilized, their symptoms went away. And over those years, we've also had a lot of birth control. Could birth control contribute to this? And Casey, the writer for the IC Network, that was the assignment I gave her 10 days ago, was to do a brand new paper on the good birth control methods for IC and what will work and what will not work. But guess what happened? Guess what happened? I have a new research study that is fascinating because it, for the first time, clearly documents in at least one patient that her IC began after starting birth control pills. Fascinating. So imagine being 18 years old. You're 18 years old, out of the blue one day, you have such severe pelvic pain that feels like glass shards in your belly. You've got frequency. you've got urgency. And then you start to bleed. So here I have an 18-year-old who's bleeding. Severe, severe symptoms. She goes to the emergency room and they diagnose her with an acute infection, an acute bladder infection, which makes sense. Somebody 18 years old, okay, that would be absolutely one of the very first things you would look at. But guess what? Antibiotics didn't work. Did not work at all. At all. Does the antibiotics? Symptoms just continue worse and worse and worse. So she goes to another doctor, and the other doctor says, you know what? I think you have kidney stones. So I think you need to take pyridium for the foreseeable future to just reduce the pain. Pyridium is the stuff that makes your urine orange, right? So everybody pretty much done pyridium at some point in time. And of course, her symptoms are progressing. And she goes to another doctor who says, you know what? I think you've got a fungal infection. I think you have vaginitis and a fungal infection, a candida infection. So they give her antifungals. Doesn't work. And then at some point in time, she's diagnosed with interstitial cystitis. They give her the diet. They give her all that stuff. Doesn't work. Doesn't work. And here you've got an 18-year-old whose life has stopped. Like she is crying. I am sure that she is just dead because that's what I did my first year. She finally goes to OBGYN, and the new OBGYN says, did you start anything before this happened? Any new medication? I realized that this girl, she'd never had sex, right? And we don't really know what led her to start birth control pills, but she did start taking birth control pills 2 weeks before her IC symptoms began. So the doctor said, you know what? Stop the birth control pills. See what happens. What do you think happened? Yeah, her symptoms went away. Within 2 weeks, she was massively better. Within 7 weeks, she was symptom-free. And so the question then is, what is the biology of that? Why would birth control pills, which limit estrogen production, and you guys got to understand, I am not totally up on the science of birth control pills, so you got to bear with me here. When I interpret that data, I'm always looking at the skin and the condition of the bladder wall. First thing that I look at, because we know you get older and you lose estrogen, your mucous membranes dry and they become more vulnerable. Hello, been there, living that right now. And so to me, my first assumption was that with the reduction of estrogen levels because of the birth control pills, that her skin and her bladder and her mucosal membranes basically just started getting drier, more sensitive. But that wouldn't explain the sheer agony that she was in. But again, there's a lot we don't know. We don't know, was she just, if, for example, if she was completely addicted to green tea or soda and her bladder getting more vulnerable because of the birth control pills, it may just be a terrible diet. The acid could have been massively bladder wall. God forbid they told her to start drinking cranberry juice and it would just get worse and worse and worse. And we see that scenario all the time. The authors of the case study, though, really focus on autoimmunity. Now, remember, we've talked about this before. Is IC an autoimmune condition? And the answer is that We don't meet all the last time I looked at a major study on it, it said we did not meet all of the criteria for an autoimmune disease, that there were 4 key markers, and we only had 2 out of the 4. So, based upon that system, we did not meet the criteria of an autoimmune disease. But the authors of the paper cite the fact that women seem to be far more at risk of autoimmune disease than men, and that they believe that it's a estrogen connection, that it's a hormonally driven connection. So right now on our website, icnetwork.org, right on the front page, I have a link to an article I wrote on this on Friday. No, yesterday. With the weeks are flying by. Where you see that baseline research, and then you can go and read the full text article, which is free. So to me, what this does is this affirms all of those patients watching this right now who have always asked, could this relate to my birth control pill? And the answer, at least according to these researchers, is yeah, we think it does. And clearly in this patient's case, her symptoms resolved dramatically and improved, and she was cured at 7 weeks. That at 7 weeks, finally, she had normal urinary tract function. So again, go over to icnetwork.org and scroll down to the blogs, and you will see a picture of a thoughtful young woman in a tan background. You can then go read that blog, which is my summary of the research, and then you can go to that research study. So if you do indeed think that there is a hormonal driven situation here for you, all you need to do is print it out, take it to your doctor. Fascinating, right? Isn't that interesting? Shannon says, I'm feeling great today, doing a 24-hour bladder diary for my appointment tomorrow. Question, why when I sneeze or cough do I leak a little? That's very common. I do too. And it's the sign of potentially muscle issue, muscles that are leaking. That's a very, very good question to ask your doctor. I think they call that stress incontinence. It's very hard to describe everything and what it feels like down there. I mean, it's just is really, really hard to do that. Start feeling that happen, things feel very stiff. That I can feel my pelvic floor muscles kind of being a little bit more rigid, especially the shallow muscles right down by the urethra and right at the entrance to the vagina. So I notice that more when my pelvic floor muscles are getting a little bit tighter. Suzanne said, had a hydrous distension, a pudendal nerve block, and trigger point injections 9 days ago. I do this every 6 to 10 months. For my IC and pudendal neuralgia, this time I developed a UTI. You're on an antibiotic now. The pressure is like an elephant in my right pelvic area. Holy hell. Well, having a UTI after a procedure is fairly common because they're obviously introducing an instrument into your body. And if that instrument has bacteria on it, and we know that biofilms can actually live on catheters and move from outside the body into the body. And so we call that a healthcare acquired infection or a nosocomial infection. So that doesn't surprise me because, I happens to be patients all the time. But the question is, elephant-like pain? Why do you have elephant-like pain in your right pelvic area? That concerns me. Do you have a fever? Do you have a fever? If you have a fever, you need to call your doctor immediately. Remember, on your right pelvic area is your appendix. And so if that is getting really, really intense, I would maybe want to go to urgent care and make sure that make sure that something else isn't going on accidentally, right? Maybe you could Google appendix and appendicitis and look at some of those symptoms there. The thing with appendicitis is when you push in, not too bad, but when you release, it can be agony. But I might be wrong there. I've never had an appendicitis. My nephew did. But you know what? The right elephant in your right pelvic area, that concerns me, and I don't know what that would be. If it's getting worse and worse and worse, I think you should go to urgent care because it sounds like something might be swelling. I just don't know what that is. Thank you, Annie. Marianne says that she was on antibiotics here. Annie says, thank you. I love your earrings. I've had these for several years. They got tarnished. I had to polish them this morning. All right. Debbie says, I need information on hormone replacement therapy. I was given Premarin, but it's $529 for a tube. We can't afford that. A couple of days ago on a Facebook Live, you mentioned another cream. Yes, most IC patients, and this is the thing. Brand names are expensive. Premarin comes from pregnant mare urine. It is very, very controversial. It's controversial because they keep horses pregnant, and it's really a despicable industry that keeps the horses pregnant, takes the babies away from them, et cetera, et cetera. A lot of these horses end up being slaughtered for food. I take great exception to that. But also Premarin is remarkably and stunningly expensive when you can actually just go to a local compounding pharmacy and get a compounded estrogen cream for under $50. It does exactly the same thing. And so don't assume, the brand name makes it any better. In fact, of all the hormone replacement products, Heparin probably has the worst reputation because it's known for causing a lot of extra irritation. I mean, it's been discussed in books about how irritating Premarin can be because of the extra preservatives in the medication. And I know that because they gave me Premarin years ago and it burned like hell. Whereas the compounded preservative-free estrogen cream is much, much more affordable and much more tolerable. Jennifer says, what does bladder PT consist of? Pelvic floor physical therapy is external and internal work to try to restore muscle health in your pelvis. And so generally the example that I use is, your muscles are supposed to be long and lean, right? Long and lean and soft and comfortable. But what happens after injury is they get tight. And so, they can stay tight, especially if you're under high periods of stress. When you're under stress, you are subconsciously tightening your pelvic floor muscles. The pelvic floor muscle group the muscle group that is the most involved in the stress response, the fight or flight response, is going to be the pelvic floor. And so long periods of stress means long period of muscle tension. So what happens is your muscle memory gets pretty messed up and your muscles are stuck in a tension pattern, or you might even have trigger points. So with pelvic floor physical therapy, what they generally do is they will use a finger and they will just very gently go in vaginally or rectally, and they will travel the length of the muscle and just try to get it to relax, to get it out of a tension into a relaxation pattern. And it works beautifully. The first major research study was released in 2008 by the National Institutes of Health that proved that pelvic floor physical therapy was incredibly successful at reducing the symptoms associated with IC. And it was that study that turned the IC world on its head, because prior to that, everybody was going, IC is an incurable bladder disease. And if that's the case, why would pelvic floor muscle therapy help? Well, gee, maybe, just maybe, structures outside of the bladder are involved. Maybe, just maybe, the bladder is a secondary victim to another problem. Like, again, a muscle injury, IC subtype 3, muscle injury, pelvic floor dysfunction. Sean says, is it unusual to be multiple subtypes? Not at all. Listen, anybody with Hunter's lesion, anybody with pain, you're going to have tight muscles. You can't turn that off. So whether it is IC subtype 1 Hunter's lesions, IC subtype 2 bladder wall driven, if it involves pain, your muscles are going to get tight in a guarding reflex, and they're going to become part of the problem. The challenge here is the chicken versus the egg dilemma. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor? If your symptoms began after chemotherapy, some sort of direct chemical trauma to the bladder wall, like using ketamine or terrible diet, drinking way too much soda, your bladder wall's being eaten away by acid or irritation, and obviously urine on a wound would hurt, and your muscles are going to get tight to protect you. Our therapeutic priority for that patient is to calm and soothe the bladder wall. We're going to get rid of the acid. We're going to do everything we can to get the bladder to take a chill pill, hoping that the muscles will then release. But that's the smaller group. The bigger group are patients whose symptoms began after a muscle injury. And this brings me to the next thing I want to talk about here. I happen to have So if your symptoms started after a fall, after a car accident, after having a baby, after a rape, after a history of athletics where you were an elite athlete or strong athlete like I was, then we know that muscles get messed up. If you were a dancer, ballerina, that's a huge, think about a ballerina. Think about ballet, right? Because normally, our spine kind of curves outward from our butt, right? Right? So there's an arch this way. But if you're a ballerina, you're taught to tuck under, right? Now, imagine doing that for 10 years. It's just not normal. That's why a lot of ballerinas have a lot of muscle problems when they get into their 20s, 30s, and 40s. It's amazing. I learned that in 1993 when I went to UC San Francisco for my first referral for IC. And the other patient in the clinic was a ballerina with the San Francisco Ballet Company who was having the same issue. So there you go. Okay, so again, your muscles are injured. And what does that do? It's called a somato-visceral reflex. So we know that organs can change muscles. That's a viscerosomatic reflex. If the viscera is hurting, the muscles will get tight to protect you. So we know organs can change muscles. But how do muscles change organs? How could a muscle injury cause the bladder wall to break down? And it was Dr. Theo Harides, a federally funded NIH researcher who first brought this to my attention 20 years ago. He said, Jill, remember, don't think that it's something from the outside that's coming in and irritating your bladder. There's always a chance that it's an internal dysfunction that's irritating your bladder. So this is the way that Dr. Weiss, the author of this fabulous book, now I'm assuming that most of you in this have now gotten this book and have read this book, right? Right. And I would make this offer. If you get this book from the IC network and it doesn't help you, I will buy it back from you because I will give it to another patient who's low income. So, hey man, it doesn't get better than that. Okay, so this is what he said. So here's the book, Breaking Through Chronic Pelvic Pain, A Holistic Approach to Relief by Dr. Jerome Weiss. So this is the scenario on how muscles will injure a bladder. A muscle injury occurs. A fall, a car accident, having a baby, abuse. Or let's just, when you fall, you suffer a compression injury. Muscles are compressed and damaged. Blood vessels are compressed and damaged. And we know that because you get a bruise, right? So in the muscle fiber itself, because that muscle is damaged, it will develop trigger points, little muscle knots, right? So they will develop trigger points. So like I've had a trigger point right here for 20 years. Like I just can't get rid of it, right? Although it's way better. So what, and he has, let me get the picture of it. Yeah, here we go. He has a whole chapter on tricky trigger points. Trigger points are created by excessive tension on the muscle fibers, tension that is generated by habitual straining, acute or repetitive tightening, trauma, or inflammation. At some point, usually after repeated assaults, the muscle fibers have finally had it and they develop a trigger point. So look, and the thing to understand about muscles is that, I mean, think about it. Okay, let's the miracle of the human body, right? So look, my muscle, your bicep muscles, when you hold your arm out, are just long and lean, right? But when you pop it, the muscle fiber shortens, right? Because you pop a bicep. My pathetic bicep used to be better, right? That is the same muscle, only compressed. There it is, relaxed. There it is, compressed. And what happens on the muscle fiber is a long and lean muscle fiber is like this. But the way it functions to help you lift things and when you need strength is the fibers slide together, right? So they slide together for strength. So these are the fibers slide together, right? And then they release and go back to their normal position until you get a muscle knot. Bam. And there's a muscle knot right here, right? And so let's look at a picture of a muscle knot. Look. Well, let's see. This is a good picture right here. So here we go. Here's a muscle knot. Now y'all know that, yeah, one of the areas where we often get muscle knots is our back, right? And there's nothing better than having somebody push on it. Because when you push on the trigger point, it usually releases. And so, you know, we want to try to get that trigger point to release as quickly as possible to avoid long-term damage. But the question is, what damage does it do? Well, in between the muscle fibers are blood vessels. And so look, you got this muscle knot and it's now restricting blood flow. And then of course, we also have nerves. So you've got a muscle knot that is also compressing and damaging, restricting nerves, right? So trigger points compress blood vessels and nerves in the pelvis. Hold on, I got to make sure I get this right. Now, there comes a point where you can have 1, 2, 3, 4 trigger points, and you don't really feel them. But then finally, a triggering event happens, which turns pain on in the area. And it could be something really mild, just like, you know, slamming on the brakes in your car because a squirrel runs out in front of you. It might be a completely innocuous little event which turns the pain on. And then all of a sudden, all of these trigger points are triggering pain from that muscle. The pain transmitters then go up to the spinal cord, right? Because these nerves are now all screaming, for lack of a better term. They're dysfunctional. They're actually not even operating correctly because they don't have correct blood flow. So he calls them sick nerves. And these sick nerves do merge up at the spinal cord with the nerves that support your bladder. So you get something called overflow or neuro crosstalk. And we know this happens because we had research years ago that was the pepperoni pizza algorithm. We know that if the bowel is injured and irritated, the bladder will also become irritated. Why? Because the nerves merge at the spinal cord. So if the nerves for the bowel are irritated, it's going to spread to all the other nerves in the area. And the same is true for muscles. If the nerves supporting those muscles are irritated, it's going to reach all of those other muscles, right? So now we have neurosensitization at the spinal cord. including the nerves for the bladder and the vulva, right? Then what happens is those nerves have now become sensitive. So now we've got flow back down into the bladder from the spinal cord of dysfunctional nerve function, neurosensitization affecting the bladder wall. Dysfunctional nerves then release something called substance P. Substance P is damaging to tissue. Substance P will cause the tissue to break down. Substance P, hey man, seriously, y'all got to understand that information is power here. You are attending a little mini lecture right here. Substance P then it triggers the mast cells to release histamine. Now, histamine is bad. When you get a mosquito bite and that mosquito bite gets all swollen and irritated, that's from mast cells releasing histamine. We used to describe IC as like 100 mosquito bites at once in the bladder wall, because wherever urine gets into the bladder wall, it triggers mast cells to release histamine. Here you go. Substance P also triggers histamine release. Then you get stuck in a vicious circle. So now you got the mast cells releasing histamine, which then irritates the nerves even more, and then you've got more nerves releasing substance P. Hold on. So this is what we know. Pelvic floor muscle dysfunction can trigger the bladder wall to start to become dysfunctional and to potentially break down. And when we look at, let's look at these pictures here for a moment, right? So we all know what this is. These are Hunner's lesions. These are big, big bloody wounds in the bladder. We're not talking about that. These have now been connected potentially to viral infections, right? Most of you, though, have something like this in your bladder. For those of you who are IC subtype 2, your bladder looks like this. So what the hell is this? This is more injury, irritation, or basically this whole neurodysfunctional process happening. This could be irritation coming from the nerves behind or within the bladder wall. So this is called a Somato visceral reflex. This is how muscles can change an organ. Now, I know it's kind of hard to wrap your head around it. It's like, oh God, that doesn't make sense. Come on, I got frequency urgency. It's got to be my freaking bladder. Don't tell me it's my muscles. Oh, my muscles. I'm peeing all the time. The reality is that this is where Western medicine fails in the area of pelvic pain, because your pelvis is a very small, confined area. Think about what your pelvis does. So remember, so here's your pelvis, right? It's from hip bone down to your crotch. So it's a triangle right here. Think about this small area. What does it do? Number one, it has the largest bones, the biggest bones in the human body, the hip bones, because the pelvis carries the weight of your torso. It has an incredible web of muscles to hold everything in place. And remember, your leg muscles attached to your pelvic bones, your torso, your back muscles go deep into your pelvis. So it is a mechanical hub. It is essential to your functioning. If you want to open your legs up and close them, that is from muscles in your pelvis. It's a communication channel. You've got blood vessels that go from your heart down through your pelvis, down your legs. You've got nerves from your brain, spinal cord that go down through your pelvis, go actually through your pelvic floor muscles down into your legs. And then, of course, you've got your organs. You got bladders, you got prostates, you got vulvas, vaginas, you got uteruses, you've got bowel. There's a hell of a lot of stuff happening in the pelvis. And Western medicine fails, as Dr. Weiss says in his book, is because doctors like to stay in their box. A urologist stays in the urinary tract. A gynecologist stays in the reproductive tract. A gastroenterologist stays in the bowel. And you know what? There's nobody who specializes in muscle dysfunction or how muscles connect them all and how nerves connect them all. And that's what, again, Dr. Weiss in this book, which is why y'all need to get this book. It's so good. That's what he says is the missing link here, is that we're not understanding how these structures relate to each other. That if you've got bad muscles that are tight and restricting blood flow, it is very hard for your muscles to be healthy, for your organs to be healthy. If you've got tight muscles squeezing nerves, you're going to have sciatica, pain shooting down your leg. What's the therapy for sciatica? Pelvic floor physical therapy on your piriformis muscles. And so you truly are an anatomical mystery to be solved. And all of these structures may be playing a role in your symptoms. And when you go to a doctor, we need a doctor to study your body. I always say when you go to a doctor, especially a new doctor, don't walk in and say you've got interstitial cystitis. Do not do that. You're going to fall down the rabbit hole of their misperceptions and potentially poor training. You got to walk in and say, doctor, look at I have intense pain on my right side right here. Can you please help me understand what that could possibly be? Or doctor, I can't sleep through the night. Or doctor, when I bend over, I get shooting pain down my leg. Or, hey, you know what, doctor, it's so weird. I'm like totally embarrassed to say this, but it's driving me crazy. I'm going to tell you right now, I feel this weird arousal thing that hurts, which is known as persistent genital arousal disorder, which happens when you've got tight muscles that are squeezing the pudendal nerve. You're not alone. It's common. And so the question then is, getting back to, so here you've got muscle screwed up. It messes up the nerves. The nerves are talking to each other at spinal cord. Then the nerves in the bladder get messed up. Then the nerves down in the bladder wall start releasing substance P, which then causes a trigger of mast cells and et cetera, et cetera. What's the right therapy for that? We have to get to the fundamental challenge here. You could be on bladder therapies for years and never get better, because the fundamental problem really isn't your bladder. Your bladder is a secondary victim of a muscle injury, a muscle trauma. And that's why when I work with patients, we do coaching. I do wellness coaching here. And so does Julie Beyer. So we work with patients one-on-one. If you're interested, we even have a support phone line you can call. And believe it or not, I actually do answer the phone almost every day. We always like to go back. I always like to go back to the period right before the symptoms began. Like, what was happening? Anything weird happened? So, like, again, with this 18-year-old girl who suddenly out of the blue developed, quote unquote, IC, intense agonizing pain. What happened is she just started birth control pills. That's relevant. But sometimes you just might not be aware of the little traumas that occur over time to the pelvic floor. So you might have been a gymnast in college or a football player in college, right? But let's use a female example for a moment. So you're a gymnast in college, take a lot of falls on your pelvis, but life goes on. You go to college. And let's just say something poor happened. Let's just say you might have been raped in college or something like that, as many of my peers were traumatized in college. So now we've got yet another direct muscle injury. You get through that. You get everything you need. Life is going on. You meet a lovely man. You get married and you have children. And then you suffer yet a third significant muscle injury when you have a baby. And then all of a sudden, the symptoms happen. Or we've got patients with vaginismus. Now, there's another group of women who literally everything has always been tight down there, and it always goes back to maybe something that happened in childhood, like falling off of a bike or falling on your tailbone, where you dread going to the gynecologist because having a pelvic floor exam is going to be agony for you because your muscles are so tight. Again, tension, 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 pelvic floor muscle tension. So there you go. Fundamentally, you could be on bladder therapies for decades and they're not going to fix it. They might give you some symptom relief, but the fundamental problem for many of you actually is some sort of muscle trauma. And interestingly, I was working with a patient last week. We had this long, drawn out discussion about this. And, this is one of those things where she told me all the therapies she'd done and how nothing had worked and yada, yada, yada. And it's kind of like I have to kind of lead the patient through kind of a logical, intuitive pathway to help them try to understand their symptoms. So then we finally get down to, okay, I don't want to hear about your therapies right now. Let's just talk about your body. And in her case, her muscles were very, very tight, and they had always been very, very tight. She'd never made that association with her bladder. But the question then is, why was her muscles tight? And we started talking again about a mechanical injury, which is something that Dr. Weiss talks about in his book, about how sometimes you could have a problem with bones where your bones are not level. They're not working together. You might have one leg lower than the other, so your hips are slightly off. And they're normally when you walk, you're even, but if you've got one higher than the other, look at the torsion that would potentially put on your pelvic floor, which would then potentially lead to long-term chronic issues. And in her case, what it really came down to was she had a terrible foot issue. She just wasn't walking normally at all. And she hadn't for years, for decades. And this goes right back to when the injury happened, when her muscles got messed up, creating the foundation for years worth of bladder issues. And her doctor had even told her that we need to work on your feet, and she just didn't understand the importance of it. So there you go. Here, hold on a second. Let me get a drink. Pumpkin spice rooibos tea. Bladder friendly. All right, so let's go back to some of your questions. There you go. There's your little mini lecture for the day. Sarah says, I had a normal cysto this week. I had a cysto this week, which was normal. However, I've got all the IC symptoms. So I'm convinced hormones have been part of my pain. I just got through menopause with little problems other than the pain I get in my pelvic area. So, guys, it was incredibly frustrating. It's often you walk into a cystoscopy or a doctor's office, 100% convinced it's your bladder. And you are stunned to have a normal bladder. It's like, no. And they're thinking that you're making it up, right? It's like, no, it's got to be my bladder. There's no freaking way my bladder's normal with this. And in some cases, doctors were very dismissive. They were like, you're fine. Get out of here. You're making it up, right? 20 years ago, that's what happened. You're fine. Your bladder's fine. You don't need me. You got mental issues. You need to go to a psychologist, right? How many of us went through that? But now we interpret that differently. If your cysto is normal, that's great news. That's fabulous news in my opinion. But now what we have to do is look at structures outside of your bladder to see if the other structures are potentially triggering the symptoms of frequency, urgency, pressure, pain. So Sarah, it could be fibroid tumors or endometriosis or Tarlov cysts or anything at all like that. Ben, you say here you think hormones can play a role. Again, I think that there's some people who absolutely do have hormonal issues. Shannon says, I was on birth control when I was 14 until I was 21, was diagnosed with endo and had a emulation 5 years ago. Actually, it's not I know what you mean. The word is escaping me right now. Now the last 3 years you've had IC, I kept going to the ER, which I thought was a UTI, but no infection. So yours is a little bit tricky here because you also have endometriosis, right? And so the question is, could the endo be growing on your bladder wall? And the answer is possibly. It's possible that that's something that's got to be ruled out, but you could also have tight muscles just because the endometriosis was so painful. Marion says, I never made this correlation, but it makes total sense. I went off of birth control a few years ago and I only have symptoms once a year now. So, Marion, that's awesome. You know, I always think that mankind is so incredibly arrogant in thinking that we know more than nature. And the reality is that nature is so much more complex than our brains would ever function. Just DNA, RNA. Think about these two DNA threads merge and they start triggering the construction of tissue, which becomes a fetus, which then grows and differentiates and creates our brain and our spinal cord and our muscles and our organs and our skin and our eyes, all in 9 months, you know, and the nature at its finest, it puts humanity to shame, and humanity should be ashamed when we think we know more than nature, when we do things that deliberately create dysfunction in normal natural processes. And so, you know, as somebody with, you know, a lot of training in drug development, I personally don't want to use drugs unless there's a really critical reason for me to be using drugs, you know, like a severe infection, something like that. Susanna, she says, hi, Jill from Ohio. It's 101 here with humidity. Girl, ooh, that's awful. I have IC and pelvic floor dysfunction. I ate some salted peanuts last night as a snack. I was up and down all night, miserable, using the restroom every several minutes with an IC flare. Are there any IC-friendly snacks you can recommend? Yeah, almond. Just, I think the problem is that you did salted peanuts. Listen, salt on a wound hurts. What's one of the old forms of medieval torture? Is wounding somebody with a sword and rubbing salt into it. Salt hurts and it causes scar tissue. It causes all sorts of awful things. And so you might have been better with unsalted peanuts or unsalted. My favorite snack right now. Oh, let me go get it. I'll show you what my favorite snack is. Hold on. Okay, I love toasted coconut. It's so good and so incredibly bladder friendly. So I ate a big handful of this last night. And then they even have, this is going to sound counterintuitive, but remember that my IC is, my bladder is really healthy right now. And so I can get away with eating more than when I had a severe injury to my bladder wall. My bladder has pretty much healed. Is they have this wonderful pineapple chip, coconut chip. But I'm not going to be eating chocolate because when I eat chocolate, I get bowel spasms. I'm just trying to eat really healthy, fresh, non-preserved foods. So I would go for almonds. I usually throw in a handful of almonds when I eat one of those. What are the almond bars, you know, that are so good? Oh, come on. What's the name of those almond bars? The Kind almond bars, the almond caramel sea salt is to die for good, and there's hardly any salt in it. So that would be much less irritating. Also a Gala apple, Fuji apple, carrots, celery with almond butter, piece of cheese, avocado on a tortilla, just munching on an avocado toast. Those would all be really, really good snacks. You could even make waffles. You can make yourself a waffle as a snack. Is there a coffee I can drink that you would recommend that's IC friendly? Well, so ironically, I just finished another blog. If you go to icdietproject.com, icdietproject.com, I just put up another blog on coffee drinks for summer. And there are some remarkably low acid coffees out there. The brand that there are 3 brands that we suggest. Let's see. The top low acid coffee by far is Bella Rosa. Bella Rosa. Bella Rosa is made here in Northern California. It has the lowest levels of chlorogenic acid in the world, substantially lower than any other brand. You know, coffee acidity is determined in 3 ways. Number 1, the altitude that the beans are grown at. The lower the altitude, the lower the acid. The higher the altitude, the higher the acid. The low altitude. The second thing is the roasting process. Most of the big mass market companies put their beans in big hot metal drums. You got these big giant drums spinning that are roasting the beans. Unfortunately, hot metal triggers the production of chlorogenic acid, which is the acid that is the most irritating when you drink it to your stomach or to your bladder. So you definitely want a coffee that has been air roasted, like an air popping popcorn machine. Some people do that. They will use an air popper for popcorn, and they will use that to roast coffee beans. So Bella Rosa created a custom roasting method that is stunningly effective at reducing the most irritating acid. So there are lots of different types of Bella Rosa. They've got low acid. They've got decaf, half calf, full calf. The other issue, of course, is caffeine. Caffeine is neurostimulatory. A lot of you do caffeine because it helps you have a bowel movement in the morning, but you also know that caffeine makes you pee more. So as a general rule, we do not recommend caffeine. The second brand would be Tyler's coffee. And I know they say the world's first acid-free coffee. That's not quite true, because in pH tests, it does have a little bit of acid in there, but that's their marketing thing. So Tyler's. And then the third one is Simpatico. And we may be making an IC network, an ICN coffee also. I was just thinking I wanted to do that. So I might do Bella Rosa coffee on a private label, have them private label it as an IC network coffee. Thinking about it. Christy says, I can't be without a birth control. I'm a heavy bleeder. And that's real. Hon, that's real. At some point in time, they might want to do that procedure where they cauterize your uterine. Once you're done having babies, what they can do is cauterize your uterine wall to stop all the bleeding too. Come on, it starts with an E. What do you call that? I must not have slept. I don't think I slept enough last night, because my words are not coming right away. It's there. It's like right at the tip of my consciousness, and it starts with an E. What do you call it when they cauterize the uterine wall? Okay. Rebecca says, can you please talk about UTIs, menopausal women, hormones, and atrophy? Absolutely. And I think I have right here. Here it is. Okay. So guys, again, with these many things that can trigger the symptoms of IC, frequency, urgency, pressure, pain, we do have to really understand the basic biology of the bladder in the first place. The bladder is the only organ in the human body designed to hold toxic waste. because urine contains ammonia and urea and all sorts of stuff. So how can the bladder hold ammonia for hours at a time and not get damaged? It's really fascinating. Well, the answer is that your bladder is like your mouth. It is a hollow organ covered with a really thick coating of mucus. Dr. Parsons calls it the mighty mucus. And so your bladder is actually a wet organ, and your urethra is a wet organ, and your vulva is a wet organ, and your vagina is a wet organ. They're mucous membranes, just like your mouth. And so if we look at it three-dimensionally, we can see that there is the blue is, now listen, your protective coating is not blue. This is just for them to show it. The outer mucosal barrier, the mighty mucus, is a very thick, robust coating that protects these cells, the urothelial cells. These are the largest single cells in the human body. And then underneath this, we have blood vessels and mast cells and things like that. Unfortunately, this blue layer is estrogen dependent. So what that means is that when you have a lot of estrogen when you're young, you have a lot of mucus. But as you get older, you have less estrogen and less mucus. And so, as many women can attest, if you've had a hysterectomy, you know what I'm talking about. Your mouth gets dry, your vulva gets dry, your vagina gets dry. So does your urethra, and so does your bladder. And what happens, unfortunately, in the bladder is that when you start losing this coating, anything in your urine is now reaching the more fragile, vulnerable cells. So the coffee that you used to drink in your 20s and 30s and 40s, all of a sudden might be hurting in your 50s because you just don't have the coating you used to have. That's not a disease process. That's called the genitourinary syndrome of menopause. The other thing that happens is it also makes you much more vulnerable to infection because it turns out this nice thick coating also makes it much harder for bacteria to infect your bladder wall. But when you lose the coating, bacteria can now reach these cells and infect these cells. And so it's quite normal for women who have had a hysterectomy or they're put into an artificial menopause with Lupron, or you're just menopausal, to start developing more urinary symptoms of frequency, urgency, pressure, pain. And again, not a disease process. It's just it's a statement about your bladder's ability to defend itself. Your bladder just cannot defend itself like it used to. There is a very clear group of women, older women, who get infections, proven infections, over and over and over again. Every 2 weeks, once a month, once every 2 months, they're back at their doctor and they have another infection. And it's a very challenging situation because we know antibiotics come with open up a whole can of worms. We don't want to be taking a lot of antibiotics because then you got side effects from that. So I attended a lecture taught by Anthony Schaefer at one of the American Urology Association conferences years ago. And he said a couple of things. He said, number one, we never tell these women they have a simple UTI. We always tell them it's complex. If you're older and you've had numerous infections, we would now define these as a complex infection. And in the research that they've done with them, what they consistently find is that the bacteria is living quite happily in the vagina about 24 hours before it arrives in the bladder. And so that made the researchers ask, well, what's happened to the vaginal defenses? Why isn't the vagina capable of defending itself against these bacteria? Why has the vagina become a safe haven for bacteria? And the answer comes right back to, bam, estrogen atrophy, because your vagina is dry too. So generally, these women, in addition to being given the correct antibiotics, are also usually given a topical hormone estrogen cream to use vaginally so that we can improve the defenses in the vagina so that it is not the safe haven that it has become. So there you go. There's my little lecture on genitourinary syndrome of menopause. There you go. If you go on over to our website, icnetwork.org, I have a Living with IC video series, which I desperately need to make more videos for. And there's a video in there called the Estrogen Chat. And I would recommend that you watch that, the Estrogen Chat. Stephanie said, have they looked at different brand names for birth control pills? My body is more sensitive to some. No, not that I know of, not yet. It's very common for people to have different sensitivities. Like I cannot take any off-label thyroid. Any generic thyroids mess me up so bad. My hair starts to fall out. All I can do is Synthroid, the brand name. Suzanne, getting back to Suzanne having this intense pain on her right side. She has no fever. So Suzanne, I really think you need to call your doctor and talk to the doctor on call, or call your doctor tomorrow and let them know about that intense pain on the right side. I don't understand why you're having that. I mean, it could be a tight muscle. I don't know. It worries me that it happened after a procedure. I don't understand why that would be. Suzanne said she had her appendix out a few years ago. Okay, well then we know it's not your appendix. Good, that's good. So that points us perhaps to, maybe your muscles went into a very, very strong contraction because of the pain of the procedure. And or maybe you have scar tissue where your appendix was, or where the scar is, depending upon how they pulled your appendix out. Is it associated with any scar tissue? Do you have a scar that is tender? All right, hold on a sec. This is driving me crazy. Okay. It's an endometrial ablation. Ablation. I was right. It started with an E. Endometrial ablation is where they cauterize and or ablate the endometrium, which is the lining of the uterus, so that you would no longer bleed. An ablation. All right. Carol says, my daughter was prescribed birth control because she wasn't having normal periods. Doc gave her birth control to regulate her periods. She was told she has polycystic ovarian syndrome, which I had too, which was the cause of her not having regular periods, and blood work showed her testosterone was high. Since being on birth control pills and normal, her periods are normal and her testosterone is normal, but she's having terrible IC since being on the pill. Painful, heavy feeling in the bladder, urgency, sometimes bedwetting without. She wants to stop the birth control to see if it resolves her IC issues, but not sure if the polycystic ovarian issues will come back. I think you're going to have a really thoughtful discussion with her gynecologist about who made that recommendation. It would be, I had probably 24 ovarian cysts, which they labeled as PCOS. And I had very heavy periods, but they never gave me birth control for it. And I eventually kind of grew past that. That stopped in my early 20s, at least for me personally. So I think you need to have a discussion with him about maybe a trial, and to see what happens. But the fact that she's bedwetting is really, that's a real sign at her age that something, there comes a time when you have to weigh the pros and cons of therapy. If a therapy has such side effects that it interferes with your quality of life, then maybe that therapy is not the right therapy. Carol, come on over to our website, icnetwork.org. Go onto the front page. Go to the blog that I just put up that talks about this case study of this 18-year-old, and give that to your doctor. It'd probably take about 2 months to really figure out if that's the issue, but it wouldn't surprise me if it was. Sean says, many ladies in my lichen sclerosis support group ask about symptoms that seem more IC related. I've referred them here. Yeah, lichen sclerosis is interesting. Hello, John. I have not been able to find blood pressure medication that doesn't cause severe bladder pain. How would I determine what in the medication might be causing that? I haven't found any other IC patient with this particular problem. You know what, John? Actually, it comes up about once a year with somebody. So believe me, it comes up fairly maybe not even once a year, maybe a couple of times a year. I get a call from a patient who's struggling to find the right blood pressure medicine. I don't, you know what I can do is tell you what, let me make a note here. So John, tell you what, I'm gonna reach out to some doctors and see if they have a suggestion for you, okay? That is a great question. Oops. Okay, guys, I'm going to go ahead and turn on the Zoom meeting too. So we'll be simulcasting on another platform also. So let me go ahead and open that up. Alrighty, so that meeting is now up and running. And let me just, I'm going to post the invitation on Facebook and YouTube. And so if you would like to come in and actually talk about your symptoms and get a little mini coaching from me, which is what we do. We just go one person at a time. It is public. So y'all got to understand, if you got something private that you'd like to talk about, don't do it online. Do it on the phone. So, okay, so there's my Zoom meeting. Oh, look at that. My earring is making it all weird. Okay, hold on. Wait. Okay, crap. Hold on. Okay, it says I cannot minimize Zoom when I'm recording. Okay, got that. All right, YouTube, I'm giving you the invitation right now. Facebook, you will have the invitation in a minute. Just know with Facebook, I have to, oh, Sean says, you were correct, Jill. When my appendix burst, I kept waiting because they thought my IC was acting up and I had a kidney stone. It felt much better when the doctor pushed down on my right side. Ooh, good. Maud says, I need your help so bad. It's been a year nonstop 24 pain. I have that pain inside the anterior vaginal wall. I can pinpoint the spot near the urethra G spot. I feel it's inflamed. I did a hydrodistension, installation, nerve block, yada, yada. Holy hell, girl. She says she has to stand up and push. Sometimes I go and there feels like there's a drop left 1 minute later. I can't handle the pain. Maud, if you can, you can come on over to the Zoom meeting or call me this week and let's have a talk. Let's have a talk. Now, Facebook, just know that I have to scroll down to enter this invite for Zoom, which means I might miss some of your questions. All right, so Facebook, you have it too. And if nobody wants to Zoom, that's fine. I got no problem with that. We just keep going. Got one person so far in Zoom. These meetings are interesting. I did a meeting Friday night. That was fun. We also set up a Discord channel. So we now have a Discord channel for IC. For anybody who uses Discord, I'll have that in my magazine. I have a newsletter that's coming out. Should be coming out tomorrow. Also, just so you know, there's a wonderful special event happening next Saturday with one of the top pelvic pain centers. Pelvic physical therapists in the nation is doing a 1-hour class on relaxing the pelvic floor. and working with the pelvic floor, and it's a fundraiser. And so I will have the details of that in our magazine, in our newsletter. If you don't get the IC Network free e-newsletter, just go on over to our website, icnetwork.org. A pop-up window should happen when you just put it in. I only send out newsletters about once every 2 months. We do not sell our database. Do not worry, you're not going to get slammed with spam in any way, shape, or form. I'm very, very thoughtful and respectful of the people who sign up for our newsletter. All right. So let's just we'll give it another 10 minutes or so and let people come into Zoom. So let's go back to Facebook here. Linda says, doesn't fulguration burn the bladder? Yes, it does. It will cauterize the tissue. They cauterize the tissue. They can cauterize the tissue with electricity, with a laser therapy, or with heat of some kind. Laser is heat. And you guys, I want to say thank you so much for all of your nice birthday wishes last weekend. It was a great birthday. I had a great time. I couldn't imagine being in a better place to celebrate my birthday than celebrating it with you guys. Sarah says, I just had an incredible doctor in Louisville. I found out I had pelvic floor dysfunction, and that's why I cannot push urine out. Exactly. And my bowels too. Exactly. It also explained my reason for not being able to have a baby. This doctor made me cry. She understood. And we have 6 weeks of bladder installations and pain injections. She was amazing. And she supports this page and is a doctor on the roster on the IC Network. I could have never made it through my journey without the information you give us. You are so amazing. And I'm so thankful for you. So Sarah, she's going to do bladder installations to calm your bladder down. But what are you doing for your pelvic floor, hun? Susanna says, where do I get the Bear coconut chips from? I get them from Imperfect Foods. I have a food delivery service called Imperfect Foods, where they send, kind of the potatoes that aren't perfect and the zucchini that isn't perfect. And they have a lot of food and eggs and meat. Oh, the meat is great, I gotta say. So that's where I got it from. I got it from Imperfect Foods, and now I just order it on Amazon. Suzanne, thank you so much for 50 stars. Guys, if you find these helpful, you can, and you're on Facebook, you can actually send me stars, which gives us a couple pennies here and there. Every little penny matters. Or better yet, come on over to our website and become a member of the IC Network so that you can get our fabulous magazine, right? This is our latest magazine. Really proud of the fact, really proud of the fact that our FDA petition, the research I did on Elmeron eye disease in support of the Emory Eye Institute, led to the FDA warning that was finally published with Elmeron a month ago. Damn proud of that. So your donations really matter because they keep us working. Pauline, I love Camp Chicory coffee. It's British and I got it on Amazon. Cool. Karen says, I've been a flare-up for a week now. Can you recommend home remedies that would help? Drinking a lot of water. All right. So Karen, if you're still here, what kind of flare are you having? Are you having a bladder wall flare, or are you having a pelvic floor flare? Do you know what kind of flare you're having? That's important because we treat them completely differently. And let me see if I can find it here. Hold on a sec. So for signing up for our newsletter, you get a free copy of the ICN Guide to Managing Flares. I'm going to be rewriting this and reskinning this week. So it'll have this month. No, this fall. Provided that we're not, we're not evacuated for fires. We just had a fire again last night, right on the hill behind us. Yeah. Okay. So when you sign up for our newsletter, you will be able to download this 40-page guide on managing IC flares, and it will give you an hour-by-hour rescue plan for each type of flare. So if your flare began because you screwed up with your diet and you really irritated the hell out of your bladder, then you're going to be doing the bladder wall protocol. So the bladder wall protocol, whoops, hold on. Oh, now my computer's being weird. Wait. Okay. Come on, computer. My computer's being all weird. Hold on. Okay. So let's just say you're having a bladder wall flare because you went to you drank something you shouldn't have drunk. So the acid or the caffeine is now irritating the hell out of your bladder wall. What do? The first thing you do is you drink water. We got to dilute your urine, try to dilute any of the irritants in your urine. So that's number one. Now don't go drink 5 quarts of water. That you don't do that. Drink a glass of water. I see patients by how they drink water. We tend to sip water over a period of an hour rather than drink a whole glass at one time. But if you're having a food-driven flare, an acid-driven flare, that's when it's okay to drink a glass. Let's get some quick dilution in there. The second thing we want to do is we want to alkalinize your urine. We want to try to remove any of the excess acid in your urine. How can you do that? You can do that with the wonderful sponsor for this meeting, Preleaf. Preleaf is a simple calcium pill, and what it does is it reduces the acid in your urine. You can take it anytime you're going to eat something that's provocative, like spaghetti or drink coffee or even alcohol. If you go over to preleaf.com, they have wonderful acid charts. So example, 2 or 3 caplets of Preleaf will reduce 97.5% of the acid in 6 ounces of coffee, if I remember that correctly. Okay, or you can do a 1/4 teaspoon of baking soda in a glass of water, or you can take a Tums, something that will help minimize acid. Your next step is usually within an hour or so is to do something like azo bladder pain relief tablets. Azo bladder pain relief tablets, which is the over-the-counter version of pyridium. Azo tablets, this is the stuff that turns your urine orange, and it helps to kind of numb the bladder wall. It quiets the bladder wall. And for mild to moderate pain, it can be helpful. For more severe pain, it might not touch it, but it is at least an option. And of course, if your flare is accompanied by fever or anything unusual, if it's frightening you, if it's scaring you, anything at all like that, you always call your doctor. We want to make sure that there might not be an infection. One of the things that you can do is use a simple over-the-counter urine dipstick test. They're not 100% foolproof, but if you come back to this on, it's basically you pee on a stick. And my dad used my last one. So I don't have a sample here. But here it is. So you're gonna pee on a stick like this, and it has 2 test pads. The top pad is for leukocytes, and the second pad is for nitrites. And here are the colors. So here, hold on. I don't want to hold it up. Okay. So the top pad will turn purple if you have leukocytes in your urine. The bottom pad will turn pink if you have nitrites. If you've got nitrites, you have infection because nitrites are only produced by bacteria. If you have leukocytes but no nitrites, that means more that your bladder is probably really irritated. And what happens is the blood vessels open to let white blood cells out to try to figure out what's happening in your bladder wall, and that then releases some red blood cells and some stuff like that. So that's why we tend to have microscopic blood in our urine, and why we tend to have leukocytes in our urine, even though there's no active infection. And I've talked about that before in these things. So anyway, if you do this test and it comes back with a positive nitrite, you call your doctor right away. You get your urine in there. You get in there, leave a urine sample, and get your urine tested. That's really, really important. If you have home installations, you can use a home installation of lidocaine and heparin to try to calm your bladder down. And then at some point in time, you're just going to ride out that flare. You're going to have to ride out that flare for 24 hours, 48 hours. Just give your bladder time to calm down from that acid irritation. So again, we're talking about a diet-induced flare from something like coffee or soda or alcohol. Now, if you're having a pelvic floor flare, let's say you're having a flare from having sex or being in the car for a long period of time, we're going to treat that completely differently. So the first thing you're going to do is get a heating pad. Go sit in your recliner and throw a heating pad on your pelvis. We got to try to get those muscles to release. You can do some of the exercises and stretches that your physical therapist might suggest to you. And one of them, oh, where is it? Hold on. In our magazine, I have. Here we go. Look at this. So in our last magazine, I did a whole thing on pelvic floor relaxation poses. And so Happy Baby is something you can do where you lay on your back and kind of roll your knees up and roll your hands up. Or prayer pose. Prayer pose is really good. When you do prayer pose, you're putting your muscles exactly where they're supposed to be. So if you're in the bank waiting to see the teller and you start getting a pelvic floor spasm, just drop your keys, squat down, hang out there for 5 seconds, pick your keys up, and that can actually put your muscles in a better spot too. There comes a time when you might need to use something like a vaginal Valium suppository once you're home. You can't use it when you're out driving because it's Valium and it might sedate you a little bit. Here, hold on a sec. Or you might use an oral muscle relaxant like an oral Valium, an oral Flexeril, or a baclofen. Baclofen is non-sedating. So again, you taking a hot shower, a hot bath, things that will relax muscles. Interesting, right? It's so interesting. We've come so far. Let's see if I missed anything else here. Kelly says, I talked to a doctor in the United Kingdom. He was saying for me, I have vulvodynia, who prescribed Osphena, and it is helping a lot, even with frequency. Awesome. But don't underestimate your muscles. Your muscles can also play a role in that. John says, how long does it take for pain to subside? Once we have the pelvic floor muscles to stay relaxed, it's usually pretty quickly. I mean, a couple hours at the most. Lisa says, I lost my taste 2 weeks ago, and after COVID test, which turned out negative, I can't figure out why I still have no taste. Then I had frequency and discomfort like a UTI or yeast infection. Doctor treated me with 3 doses of diflucan for yeast, and your sense of taste has come back. But how do I know that is really the problem? Could it just be a type of IC flare? No. I'm telling you right now, IC does not change in any way, your ability to taste. I mean, and we're learning a lot about COVID tests that turns out were not reliable, and so if you lose your sense of taste and you lose your sense of smell, that's not IC in any way, shape, or form. However, if you have a candida infection in your mouth and you have thrush and a white tongue, maybe that could have been it. I'm not sure, but it's certainly not an IC flare. Hi, Rita. Hi, Gay. Maud, again, I really want to try to talk to you this week. All right. Okay, let's switch over to the Zoom meeting. I'm going to go ahead and I'm going to put the Zoom invite back into Facebook and back into YouTube. Oh, well, let's see. Hold on. Nancy says, I went to my physical therapist on Tuesday, was in a flare. Doctor sent me for urine culture, still waiting. Now I have a cloudy and a god awful smell. I know I have an infection. Hope they find the results first. Billy says, I can't get up from a squatting position. Is this not normal? Yeah, that's an issue. Emily says, Jill, I need you. Emily, I am right here, my dear. I hope you'll come into the Zoom meeting. But I'm here. I'm not shutting down Facebook. Marianne says, I'm so upset. I thought it was a UTI, but I'm afraid it's icy. Hey, listen, guys, seriously, you know, we no longer think of IC as an incurable bladder disease. Don't get freaked out about this. Don't get freaked out about this. For some of you, there are muscle issues going on. For others, there can be other issues going on. This is not a death sentence in any way, shape, or form. And listen, we are in great shape right now. We have better treatments. We've got better therapies. We understand a hell of a lot more. I don't want you to be afraid. IC doesn't scare me anymore. A flare doesn't scare me anymore at all. I know what to do. I know what triggers them for me, and you can get to that same position. But ultimately, it comes back to understanding your anatomy. Billy says, I can't get back up from a squatting position. Is this not normal? Well, as we get older, things change. And so you can squat, if you can squat next to a chair and use the chair to help you get up, or maybe what you've got to do instead of squatting is lay on your back and do the position on the happy baby position. Work with a physical therapist, I think, would probably be able to help you the most. Lisa says, is famotidine similar to pre-leave? I don't think so. Emily says, I'm serious. I've had pelvic floor dysfunction for 15 years, had manual physical therapy. The other day, the guys were cutting the lawn and it was so loud. I peed like that. Okay, I don't understand, Emily. Emily, I don't understand. Okay, you guys on Zoom, just hold tight. Hold tight. I see you there. Okay, so hold on a sec. Hold. Strangest thing ever. When I put my fingers in my ears, my pelvic floor tension goes away and I can pee immediately. I have no idea. I have no idea. I mean, we know that people have central sensitization. We know that some patients have a wicked sense of smell. We know some patients have a wicked sense of hearing. They can be visually sensitive. They can be audible sensitive. They can have sensitive skin. So it sounds like it might be some central sensitization, but Emily, I just don't know. And I don't know. You've had pelvic floor for 15 years, manual physical therapy. The other day, the guys were cutting the lawn and it was so loud. So I peed like that and it was immediate. I don't know. But anyway, call me. Call me and we'll talk. All right, guys, let's go on over to Zoom. Wait a second. Vaughn says, hi, friends. New here. Do I think IC is related to a hormonal imbalance? After having traumatic labor delivery 13 years ago, I never had a normal cycle due to scar tissue on the inside of my uterus. Right before turning 40, I started experiencing UTI symptoms. I had seen several doctors for the past 3 years that told me to have a hysterectomy. Thank God I didn't. I found an OBGYN, a urogynecologist who told me I have IC. I started becoming more hormonal with my body changing and gaining weight. In the past 4 weeks, I've changed my diet. I've had 4 installations. Seems to be helping with the spasms and frequency. Is there anything you would suggest naturally to cope with this pain? So again, Vaughn, it's about what's triggering the pain. Is it the bladder wall or the pelvic floor? It sounds like you could be having some genitourinary syndrome of menopause, perhaps. If you can go on over to our website, icnetwork.org, and watch the video, the estrogen chat, that would be really, really helpful. But we've got to try to figure out, is it from your bladder or your pelvic floor? Emily says she's being ignored. Emily, hun, I'm not ignoring you at all. I am not ignoring you at all, my dear. If you could come into the Zoom meeting, that would be great. Then you can tell us about it and I can ask you questions. That would be awesome. I get that you're serious, hon. It's baffling. You know, okay, so Emily, let me Emily, okay, let's think about this a different way. Emily, let's think about this a different way. In this book, in this book, okay, hold on a second. Let me take a step back. So there is a connection of pain syndromes that often come together at TMJ, which involves this joint and the ears. That's TMJ. How many here have TMJ? I have TMJ. Lots of IC patients have TMJ, right? Okay, so we know that that chronic pain patients often have TMJ. Chronic pain patients often have bladder issues. They have bowel issues. We tend to have very, very sensitive skin. And it's called myofascial pain syndrome. Myofascial pain syndrome. So that involves muscles and fascia. So what is fascia? Have you ever gotten a chicken breast? And on top of the muscle, you take the skin off, and then on top of the muscle, there's that thin layer of white tissue. That's fascia. That's fascia. Fascia basically, our whole body is lined with one continuous layer of fascia. Fascia is important. And Dr. Weiss in this book talks about how, for example, they now believe that TMJ could be ultimately linked to disruptions in the fascia that began in the feet. That if you don't walk correctly, you've got one leg longer than the other. Not only is that impacting muscle, that's impacting fascia. And the problem is it's all one piece of fascia. It's not different pieces here and there. It's all connected. So if the fascia in your legs are messed up, then the fascia in your belly is messed up. Then the fascia in your chest is messed up. Then the fascia in your neck is messed up. And they think that that is one of the reasons why pain patients have TMJ is because underneath it, it's a fascia, it's a mechanical fascia disorder. So that's like the only thing that makes sense in your situation is that you clearly have TMJ. You clearly have TMJ like some of us. And so I would be looking at overall, well, and look, there you go. You say you have chronic migraines due to your neck. All right. So we know that chronic migraines are triggered from muscles so tight that they're squeezing blood vessels. We used to call IC a pelvic migraine. Did y'all know that? IC, a pelvic migraine. So Emily, you just proved my case right here. We know you have TMJ. We know you have tight dysfunctional neck muscles that are triggering migraines for you. The odds are you also have extremely tight pelvic floor muscles, et cetera, et cetera. Emily says, what can be done for jaw pain? I clench at night. I wear a guard. And I try not to sleep on my stomach, but I have to sometimes. But I have my ears ring all the time. I can't turn that off. My ears ringing are always on. Okay, Erica says, I'm so confused. Was diagnosed with IC when they nicked my bladder during my hysterectomy. I was 24. I've had surgery every 3 months for 10 years. I went to the Cleveland Clinic and they're saying I don't have IC. So what, Erica, you are a surgical injury patient. This is not a disease process for you. This was a surgical injury. They nicked your bladder when they did a hysterectomy. So your bladder was traumatized. They probably had to suture it together, and you would have had other issues related to that. So Erica, please feel free to call me. I would love to talk with you a little bit more. The odds are your bladder's probably healed quite nicely, but you probably have some remaining muscle problems and or stuff like that. Emily says she also has ear ringing, just like me. Emily, girl, like seriously, you're my IC sister. Okay, guys. All right, now I have to go to Zoom. You guys have been waiting so long. On Facebook, I just put the invite back in. And on YouTube, I am giving you the thing again. Emily says you're brilliant. No, it's just this weird memory. Guys, I study it. I read it. That's why, Emily, you have anybody in this meeting, Emily, you need this book. Get it. On our website, we have our 800 number. On our Facebook page, we have our 800 number. Okay, guys, Facebook, I will come back to you, but we have to go to Zoom. So I'm going to minimize Facebook so I can't even see you. All right, YouTube, same thing. All right, you guys are going to hear this list. Hello, Zoom. I see you guys. Hello, nice to see you. Hi, Patty. Hi, Chris. Hi, Linda. Hi, Lisa. And hi, iPhone, whoever you are. I'm going to go to Patty first. I'm going to try to unmute you. Hi, Patty. Yes. Hi. And was that your husband who just walked by?
No, that's my dad.
Your dad? Oh, okay. Tell your dad hi. Tell him to peek his head in. We'd like to say hi. Come here, Dad. Come on, my dad.
I'm at my parents' house right now. My parents are hiding.
Oh, no, come on. My dad comes in all the time. He's welcome. He's welcome to wave. All right, Patty.
Yeah, I thought my mom would be interested in seeing this live with me.
All right, hon. Tell me what's going on. How are you doing today?
I'm doing all right. I mean, I'm during my flare week. I'm on my period, so my IC's, bugging me. But I've kind of figured a few things out recently, which made me super excited.
Okay.
I found out that pretty much cutting out dairy, sugar, gluten, and starches has really helped with the pelvic pain.
Okay.
So that's been great. And this Friday, I have my appointment with my urologist. So, but yeah, I wanted to. What?
Well, so that brings two things to mind. Okay, so for those on Facebook and YouTube, what she's saying is eliminating dairy, sugar, and what else did you eliminate? Wheat?
Yeah, gluten and starches.
Gluten and starches. So that makes me think of two reasons why that might be the case. Number one, could you have an underlying gluten intolerance? I know for me, like I do not have celiac. I got tested for celiac. I'm negative for celiac, but I feel
I've been tested too.
But I feel way better going gluten-free. Mm-hmm. Gluten makes me bloat up and get very gassy. Like I made gluten-free waffles this morning and I'm fine. I'm not swollen at all. But if I'd had any wheat-based, I would have swollen like that. So that would be one. But the other thing that I just think is so interesting now is the fact that sugar, losing, here, hold on, I'm letting somebody else in. Losing the sugar makes you feel better. And remember, we have that research now, which has found that quite a few patients have candida infections in their urine. And what does sugar do is it feeds candida. And so I always say to anybody, if you flare when you eat sugar or carbs, we always want to make sure that there isn't an underlying candida infection in your bladder itself. And of course, typical urine tests won't find that, but next generation urine tests will. And people can learn about that. Go to bladderhealth.org to learn a little bit more about that. Okay.
Yeah, I was actually going to ask my urologist about the next gen testing and candida and everything. Like I have a list of things I want to ask her about.
Well, just remember, she may not know about some of this, bring supporting information. And the next gen testing is a real hot button right now. It's a hot button because number one, health insurance companies often don't pay for it. Therefore, they poo-poo it to their clinicians. And so then the clinicians poo-poo it to their patients.
What test?
A next generation urine tests, Linda?
Well, that's the one that you just held up.
Yeah. Yeah. Okay. So don't be surprised, Patty, if she's like, I don't know. And you can say, listen, I'm curious. I'm willing to pay for it. It's $199. Would you be willing to at least sign it? Let's just see what comes. Let's just see what comes of it. And you can say you can actually bring the research from the National Institutes of Health, which we have on our website, that proves beyond a shadow of a doubt that some patients do have candida infections in their urine. And all you need to do is go to our website and search for candida. Okay.
Okay.
Jill, if you get that test that you're talking about, does that do a battery of candida and that other micro?
Yes. Yeah, just go to the website, bladderhealth.org, and it will tell you everything about it. And it has a whole bunch of videos of doctors who use it.
You said it's $199 to do it through them?
Yes.
But can you take that to your neuro, and maybe it could be done through your medical health work?
It's often, it depends upon what they're willing to cover, hun. They might cover it and they might not cover it. So just hold your questions. I need to go back to Patty, okay? All right, Patty.
So, and then I had a couple questions that I wanted to ask you, especially after reading the book on holistic chronic,
Okay.
the book you keep recommending. I got it and I read it.
What'd you think?
Oh, it was really interesting. And it was really interesting to see how everything's connected and how the body works. And I was really fascinated with the process your foot goes through taking the step.
Right.
It had me think of a few things. Like it said, like when I was younger, I did a lot of horseback riding and bike riding. And there was one incident when I don't remember. It was a long time ago. I probably was in first or second grade.
Okay.
I know it was before we moved. My foot got stuck in the stirrup, and my friends and we lost control of the horses because the horses were going back to the barn, so we couldn't stop it. And we went around a corner, and I went flying until my foot hit the end of the stirrup, and I got dragged. Yeah. So that's like the one injury I can think of that I've had. But I don't remember how badly I was injured because I don't remember anything from it. I just remember seeing my foot stuck. I remember going flying, and next thing I know, I was on the ground. And
that's the thing is children are so resilient. You could have easily had a more significant injury, but you just might. In fact, somebody that I follow, 21 years old, broke his hip. And he didn't even know his hip was broken. And not only was it broken, it was crushed. He fell off a hot tub that fell 10 feet down into a ridge. And so you might not have been able to verbalize it, and or your bones and your body are so elastic when you're younger that anyway. So the real question is what is the health of your pelvic floor now?
Mm-hmm. Yeah. And then the other thing is that I noted my mom said when I was born, the doctor told her I had floppy hips. Have you ever heard that term before?
No.
Yeah, she said he told her I had floppy hips, and she had to triple diaper me. And she can't remember what the doctor said about that. So I've been trying to figure out what exactly does that doctor mean 38 odd years ago about floppy hips.
So do you feel like you walk normally?
I think so, but I've had physical therapy before for some pelvic floor therapy and also with my back, and I know that the physical therapist would have to adjust my hips, and I've had a massage therapist say that it seems like I'm out of alignment too, so I'm kind of wondering how do I go about finding out if I have like one leg longer than the other.
Well, the physical therapist should be measuring your legs at the first appointment.
Okay.
I mean, that's normal. They're supposed to measure your legs at your first. It's always kind of hard to do it, and of course, depending upon what's tight and what's not tight, it might be slightly weird. But it would be normal for them to do that. Here, hold on one sec. Okay. If you're in here calling the IC network, I'm not answering the phone. Okay, I'm not disrupting this to answer the phone. I think it would be really interesting for you to go back to the physical therapist, number one, and tell them about your sloppy hip diagnosis and have them watch you walk.
Okay.
Just out of curiosity.
They didn't do any measuring that first time. There was no measuring.
And ask them to measure. And ask them, I'd be very interested in seeing what your overall hip function is like. And then if they think, it's slightly off, it might be higher on one side or the other, it might be really interesting to go to a physical medicine specialist or an athletic trainer, one of the really top elite athletic trainers like that work with football teams and things like that. And have them study your hips and see if they can see anything unusual. But let me ask you this question. When you first started going to the OBGYN, when you were however old, a teenager or whatever, was it painful?
Yeah, like having an annual, like I like to call it poking and prodding.
Yeah.
Having an annual was like uncomfortable to have them insert the
speculum. Yeah.
Yeah.
And
not super painful, but it wasn't. It was definitely was not my top 5 things to do.
Okay, now I see a wedding ring on your hand.
Oh, yeah.
Okay, so if you don't mind me asking a bit more of a personal question, is intimacy comfortable or is intimacy more painful?
Penetration is painful.
Okay, that's all you need to say.
I can say that back in college, I had a guy say that I was small down there. So
okay, well, yeah, but we stretch. We're every girl's small at first, but things change as we become sexually mature. But what shouldn't be happening is it shouldn't necessarily be painful, and that points to the fact that you could have had a fundamental hip dysfunction from childhood that created a long-term pattern of chronic pelvic pain that manifested itself as vaginismus. The first symptom being for you, pain with intimacy, pain with examination, pain with your OBGYN. So I think it would be, you've got the book and the, whoops, have you read the whole thing?
Yes.
Okay. So I would want a really good physiatrist, a really good physical medicine specialist to study how you're walking, or a podiatrist, because a podiatrist can look at your feet and then look at how you're walking. So that might be easier to set up, but it'd be fascinating.
Yeah. All right.
And at least, I mean, what I hope you and other patients get from this is none of this was your fault. You did absolutely nothing wrong in any way, shape, or form. That this relates, in many cases, chronic pelvic pain relates to bony structures and slight dysfunction in, fascia and all sorts of stuff. So, I hope that by reading this book, you have a lot more ideas. You have a lot more understanding of the sequence of events that can lead to where you are today. And ultimately, in the end, we can't fix what happened to you in childhood, but what we can do is try to study your body today and try to figure out, what would be the best way to give you normality. But we just don't know what's abnormal right now. Is it your SI joint? Is it your hip? Whatever. People keep asking how to get a hold of me. Guys, go to the website, icnetwork.org. There's a contact us page right there. The phone number is on the top of every page. You can call. I'd be happy to talk to you. Okay, so Patty, I hope that you go back to the physical therapist, and first step is just have them look at how you're walking and see what they got to say. Okay.
Yep, that's my plan.
I'm so glad that you read the book. That's great.
Yeah, me too. It was really good. I definitely recommend everyone read it. It was interesting and eye-opening.
Good.
It gave me a lot to think about.
Excellent. That's what we love to hear. All right, I'm going to mute you, and we're going to go on. Now, the first person who came in, we don't have a name. It just says iPhone. So, iPhone, whoever you are, I'm trying to unmute you. And I cannot unmute you. So, whoever you are, hi.
Hi, Jay. Jen.
Jill.
Can you hear me?
I can
Jay,
hear
sorry.
you. Yes, I can hear you.
Hello, how are you?
Here, hold on. Oh, I feel like I should
Hello,
answer.
everyone. I'm trying to put my camera on. Sorry.
That's okay.
Oh,
You're
gosh.
fine. Here
I don't
you.
know what's wrong.
Hey,
I have
while you're
on my camera. I had some questions last week from you, but I didn't get a chance to ask it. So I think tonight is the best
okay.
opportunity to speak to you.
All right.
I'm calling. Actually, I'm from UK,
Yes.
and I've got IC jail since 2016, and currently I'm in a really bad flare-up. I cannot eat anything. It's just too much, Jill. Honestly, I lost hope on the medical field in the UK. I feel like they're all useless. There's not enough help. When I went to urologist in 2016 and 17, the only thing they advised me at that time was just control your diet. That's it.
Well,
Nothing else.
it'd be nice if they would tell us why you were so diet intolerant, right? Wouldn't it be nice if they gave you an explanation? So,
not really. It was the first urologist I saw. Actually, my IC started from a kidney infection. So basically, I had a vaccine for flu jab, and then I had a really bad cold after having that vaccine.
okay, so wait. Hold on. Tell me what you mean by back thing. Explain the back thing a little bit more.
What actually the first time what I'm thinking is my IC started from a vaccine. Vaccine for flu vaccine.
Oh, a vaccine. Oh, a vaccine.
Yes,
I thought you were referring to your back.
No, excuse my pronunciation. Yeah, actually, I had a flu vaccine, and then after that, I think after 2 days, I had a really bad cold in 2016, and after that, I was at nighttime. I wake up with a really bad back pain, and then I went to see my GP. They've done a urine dipstick, and they find out I've got kidney infection.
Okay.
So they prescribed me antibiotics for 7 days, and then the kidney infection gone. However, the burning and urgency didn't go at all. So I had to go back to them, and I said, I don't know why the urgency and the burning sensation is still there. So they've sent my urine sample to the lab, and they said, oh, there's no infection. And they give me a different antibiotics. So I've tried different antibiotics. Still, it didn't go. It didn't work.
Okay.
And then slowly, at the time, I didn't even know I have IC. Even now, I'm not 100% whether I'm having IC or am I having something else. So and then when they see that this urgency is not going, then they refer me to urologist. But when I went to urologist and described all my symptoms, so based on my symptoms, they diagnosed me with IC. I told them I cannot drink coffee, I cannot have sugar, I cannot have acidic food, fruits, all these acidic food, and they were like, okay, so you have IC, full stop. And they didn't even do cystoscopy, nothing. They said it's fine, just control your diet, you will be better. So I was then I tried to control my diet, stay in alkaline food, and then my IC is gone about like for 6 months. Then again it came back when I started eating this acidic food. It came back, and then since then I've lost really. Yeah, actually, this is how my journey started. And every time I'm going, and they were like, okay, if you want us, we want to do the cystoscopy and biopsy, but I'm against the biopsy because I've read a lot of information about this biopsy that the symptom gets even worse. So I said to them, I would not consent for biopsy because my bladder is already injured, and I don't want you to injure it more, because I know I didn't have any problem. I suddenly got this problem through a kidney infection. Before then, I was a healthy person. I have no underlying condition, nothing.
Okay.
So I don't know. And since then, I'm on and off from these flare-ups. And
so let me ask you, okay, hon. So let me ask you questions, okay? Okay, so number one, how old are you?
33.
You're 50?
No, 33.
You're 33.
33.
Okay, so it started when you were 29.
Yes.
Were you having normal periods?
Yes. Yes.
Okay. Take me back to when you were 29 years old. Were you working at the time?
I was a student nurse at the time, yes.
You were a student nurse at the time. Okay.
Yes.
And you had no issues prior to this.
No, Jane, no. I was 100% healthy person. I had no any other condition. And the reason that I got this vaccine is because I was working in the health setting. So they say to me, it's better for you and for the patient to take this vaccine. And that's when that vaccine started to change my life.
Well, I know, but we don't have, I don't know if we can actually, I know that we always have to think about cause and effect. And yes, that was a triggering event for you. But we really don't have any data which has ever linked IC to any type of vaccine. And so, and I would know because I go through so many of those studies. Now, that doesn't mean we can't dig back into the research and look again, but off the top of my head, I can't think of any study that's ever pointed in that direction. So again, we think about the urinary tract, like any other part of the body, can be irritated and or injured. And the fact that you're so young points to injury more than anything else, especially given the fact that you are so diet sensitive. The fact that you are so diet sensitive tells us that your bladder wall is absolutely involved. So let's think for a moment about chemical exposures and chemical trauma of some type. Now, when we did a professional survey of IC patients, we were curious about were there any professions that were more strongly linked to IC? And the answer was yes, there was. The number one profession associated with the onset of IC is nursing. Number two is teaching, but number one is nursing. And with the nurses that I've worked with, in many cases, it is one nurse in particular was really interesting, and one of my best friends is a nurse, and it's fascinating. Is that she literally hadn't drunk water in 20 years. That she and her nursing friends only drank Crystal Light. Like they only drank Crystal Light on duty, which was hysterical. And her bladder was just toast. It was so badly irritated. And so I'm just curious, when you think about your training, and also nursing training, any medical training is very, very rigorous. It's extremely long hours. We often rely on caffeine and to get us through those long days. I'm curious, what was your diet like back then? Were you drinking a lot of coffee every day or anything at all like that?
Well, you mean before IC?
Yes.
Or when I
in the months leading up to the onset of your symptoms.
Actually, yes. Before that, I wasn't drinking enough water.
Okay.
And I know I didn't have a good diet. It was absolutely unhealthy diet.
So when you're young and you're in your teens and even your early 20s, you can your body is young and spry enough and healthy enough that it can recover from injury very, very quickly. But then we have kind of repetitive trauma. We have repetitive traumas. And eventually, starting in your 30s, and he talks about that in this book, by the way.
I did order the book and I'm reading that book.
Yeah. So he talks about how in your 30s, you start to feel more kind of cumulative injuries. And so to me, I really have to wonder if your bladder suffered from some sort of cumulative trauma. And I have to wonder too. Now, so what you just said is that when you went on a no acid diet, your symptoms went away completely, correct? For 6 months. And then when you started the eating risk foods again, your symptoms came back, correct?
Yes. And even now I'm in my alkaline diet.
Are you on birth control? Are you on birth control?
What do you mean by that?
Or birth control pills? Oral contraceptive?
No.
Okay.
I don't use any constipation.
What about when your symptoms began 4 years ago, though? Were you on birth control then?
No, actually, I had a coil inside. I wasn't taking any pill.
Do you still have that now? That IUD?
No. When I had IC, I had it for the 2 years as well. Then my urologist asked me to remove it because I was keep getting this recurrent, and even though I had my IC, I was keep getting this recurrent infection, UTI.
Okay.
So the urologist thought that could be this recurrent infection is due to coil. So I've removed that.
When was the last time you had a positive urine culture?
Oh, actually, not long ago. Maybe 4 months ago.
And what was the bacteria?
I don't know.
Okay, so
mainly in UTI, so chlamydia, something. Not chlamydia, the other one. Sorry.
Well, it can be E. coli, staph, strep, et cetera, et cetera.
E. coli. I think it was E. coli.
Okay, yeah. So we're to everybody watching, guys. From this point forward, you may not accept anybody saying you have a UTI and walk away. Your next question is, what is the bacteria? You have to start tracking the bacteria over time. Because if it's the same bacteria over time, E. coli, then we're going to go, all right, it's either a super drug-resistant E. coli or you have a source of E. coli in your daily life that is constantly inoculating you. So go back 4 years ago. Did you have any positive cultures 4 years ago?
Yes, I did, yeah. E. coli.
At the same time, at the same time your symptoms began, did you have a positive test?
At the same time, when they diagnosed me, my test was positive for E. coli as well. When they diagnosed me first with the kidney infection and everything, and that showed off because I remember the doctor said to me that you have a kidney infection as well as UTI at the same time.
Well, a lot of infections now are coming from food. There's this old perception that women who get bladder infections do it because they have bad hygiene, and you get the lecture on wiping front to back, which is so incredibly insulting. We now know that quite a few, especially E. coli infections, especially super drug-resistant E. coli infections, are actually coming from meat, pork. In fact, there's a brand new one, just like a month ago. They found this super bug, again, another super bug in China. So we have confusion here. So there is confusion here. There are two kind of logical lines of thought. Number one is acid erosion of the bladder wall, which you're responding to a low acid diet supports. But then you also have a recurring history of UTI. And so we don't know what's happening with that. We don't know if you've had a chronic UTI for 4 years. We don't know. And so, there's a doctor over in England. His name is Dr. James Malone Lee. He is the chronic UTI kind of king right now. And he is the one who believes that a lot of patients with, they make very sweeping statement that every IC patient has chronic bacteria infection. That's just not supported in the research, because here in the States and in Europe, we're finding fungus and virus. But that said, that might be an interesting consult for you. But I think it would be even more interesting to rule it in or rule it out once and for all with a next generation urine test.
From my GP, I did ask them about this next generation DNA urine test, because I found it in your website, and thank you so much, Jill, for supporting us. But they said they are not aware of this in their lab. So I'm thinking to refer me back. So if they can refer me back to the hospital, so I can get this help from the urologist, because at the moment I'm not under the urologist. So I just went back to my GP and told them that this, now again, I cannot eat anything. It's getting too much. So I want you to refer me back to the different urologist. So last time it was a different one. This time I'm gonna try a different. There's a big hospital in central London, so I'm going to go there to see urologist, and I will ask about this.
So you know that the UK health system is fairly limited. We know that. We know that IC patients have trouble navigating through that system. So you especially, I don't want you to walk in and say you have IC. Do not do that. I think you need to walk in and say, I am a mystery. At the age of 29 years old, I developed a kidney infection and a bladder infection that was incredibly severe. And since that time, I have recurring symptoms. And I'm confused. I'm confused. And I am here because I want you to help me understand what could be happening in my pelvis. Specifically, number one, I would really like to know if I have a drug-resistant rarer infection. Could we order a bit more of an extensive test? I'm not, and just say this, if this has been going on for 4 years, I think at this point in time, we can admit that what everybody's done in the past has been ineffective because it keeps coming back. And so I would like to take this one step forward and try to identify if there's any unusual pathogens in my urine. And say, I've been online. You can say that you talked to the National IC Support Group leader in the United States, and that here in the United States, we're finding some fungal infections, we're finding some viral infections, and that next generation urine testing is helping us understand these more unusual, rarer situations. And so, and then Microgen, the company here, I do believe they work with patients in the United Kingdom. And that is potentially doable. You could pay for it out of pocket and just have him sign the paper and just say, what do we have to lose? Well, we have got nothing to lose. We're just trying to get good factual information. And if there's somebody here in the UK who can do the same, then that's great. Let's just do it. I think, but we have to admit 4 years has not gotten me anywhere. So that's number one. And I think number two, I just say, what baffles me is that when I am on an extremely low acid diet, my symptoms go away. Marianne on Facebook says, do you need a doctor to order the test? No, you can order the test yourself, but there will be a piece of paper you will need a doctor to sign when they send you the test.
So do we have it in here in the UK, Jim?
Oh, I'm sure, because the COVID testing is all next generation testing. The viral testing is all next generation testing. So this is, the UK has been doing it. Europe has been doing it. It's what all the top infectious disease doctors do now. And so you could even ask for a referral to an infectious disease doctor, and just say, listen, the infection keeps coming back. Why? And again, if it's the same bacteria over and over and over again, then you either have a super drug resistant form of that bacteria, or there's something in your daily life that keeps re-inoculating you, like a bathtub with jets in it, where the jets have been installed incorrectly. Normally, the jets are installed at a downward angle, so any water that gets in there will drain out. If the jets are installed horizontal or slightly reverse, those little jets become nice little bacteria factories that can be there for years, infecting you every time you take a bath, if you're taking baths. So I think that that's reasonable. But the other thing that I would really want to know is, what is the quality and health of your skin? Is your vulva dry? Is your vagina dry? Is there anything else that speaks to the quality and health of your skin? Because
not really.
Okay.
No, not my vulva, not my vagina. I do have a normally dry skin in my face, my hands, but no dryness down below. No.
Well, you might not. You can have dry skin, but it still feels moist. It's just not as moist as it should be. I would want somebody to look at your skin down there, see where you are, and see how healthy your skin is. Because if it's showing any unusual patterns, then we would want to know that, because that would potentially explain your food sensitivity. And I think ultimately, in the end, it's been 4 years, and at some point in time, it would be nice to have somebody look and take a look. Could you have a bladder stone floating around in there? Could there be a kidney stone that's been floating around for a couple of years, irritating your bladder wall? I don't think so, but at some point in time, it's only reasonable to let somebody take a look and just see. I would hate for this to go on for years and years and years more, only to discover after the fact it was a little kidney stone floating around in your bladder that's just cutting your bladder wall. And once they take it out, it might go away. So I don't know. I think that there are a lot of different things you should be exploring. So let's just to summarize. Number one, the possibility of a weird infection, next generation testing, maybe even a consult with James Malone Lee. Everybody on Facebook, remember, I made that referral. Number two, I would want to know the quality and health of your skin down there. And then also, you know what, let me just play devil's advocate for a moment. Do you take a multivitamin?
Not really at the moment. As I said before, it's because whatever I'm having, except this alkaline diet, it really irritates my bladder badly and brings my flare up back. So I did buy some multivitamin, and I couldn't eat it because of I think it was high in acid. So I couldn't eat it, and I give up.
Okay, good. Don't do that.
Now I've lost a lot of weight because of not eating too much protein in my diet. I've recently lost a lot of weight.
Are you saying that eating proteins flares you?
If it's meat, yes. Dairy products, yes. Any kinds of meat I cannot eat, especially when my flares are really bad, which is now, and I'm in a pain.
Okay, so, hun, I mean, that's very, very unusual. I think I'm going to double down on a hydroextension cystoscopy. They got to look at your bladder, hun. That's so incredibly extreme. I wonder if you have a Hunner's ulcer or a Hunner's lesion that's giving you such extreme diet sensitivity. Because protein shouldn't be flaring you. I mean, you're saying you can't even eat chicken?
No, no, no.
Yeah, you
I
got
mean,
you.
2 weeks ago I had it, and that's when my flare up gone really worse. So
What,
and then I stopped it. At the moment, the only protein I'm taking is just red kidney beans and chickpeas. That's it.
yeah, you got. I think it would be. I mean, I'm just. Hold on. I'm just making notes here. That's so unusual.
So what?
I'm
what do you think is
gonna
important?
ask around, hun. I'm gonna ask around about the protein sensitivity. But you need to be very crystal clear with your doctors that you're not able to eat hardly anything right now, and that you're losing weight, and you need help pronto. You need help right away. And at this point in time, given that extreme sensitivity, what any doctor over here would say, it's time to look. It's time to look, and it's time to biopsy. I wouldn't be afraid of the biopsy. At this point in time, you're forcing everybody to guess. We have to stop guessing. We need facts now.
Jill, I'm scared if they, biopsy, if they take like a sample from there, I'm scared of if they are, injuring my bladder even more.
Well, hon, but your bladder's already just about as injured as it's going to get. If you're barely eating because foods are irritating you, that tells me that your bladder is very, very injured already. And so I think that you have to give them the opportunity. You're forcing them to guess. And at some point in time, they need some pathology results. They need to be able to look more closely. I wouldn't be afraid of it. I would be afraid of not doing it. I think that at this point in time, you need information, and that a biopsy might give you really good information. But this is something seriously dysfunctional is happening in your bladder, and you got to give them an opportunity to look and study it more.
Yeah, the problem is what happened is during this 4 years, I've done lots of research. Unfortunately, there was so many negative feedbacks out there, and there was some positive, but the more positive things that I've recently joined your network, and I got it that I give me a little bit of hope that there is some hope. But
well, yeah,
what I really find out is the girls who went for biopsy and the cystoscopy and biopsy, their symptoms gone even worse, especially with the bladder injury. If you have already injury, symptoms.
Okay, but you can't let anxiety drive your decision making right now. You are in a crisis. If you're not eating, you're in a crisis. We need information now. And let's not catastrophize and assume the worst, because for all we know, they could get in there and say, we don't need a biopsy. We know what you've got. You've got a Hunter's lesion, and it might be necessary. But don't tie your doctor's hands. We don't want to tie your doctor's hands. We've got to try to figure this out. There's something profoundly wrong with your bladder wall if you flare with something as simple as a piece of chicken. And so what the American Urology Association guidelines say is that if a patient is getting worse rather than better, if a patient is not responding to therapy, it's important to stay back and take a step back and revisit the diagnosis. And at this point in time, we don't know what your diagnosis is. We don't know if it's chronic infection. We don't know if it's Hunter's lesion. We don't know. No one knows. You don't know, and they don't know. And so you are the epitome of an anatomical mystery to be solved. And the good news is, if it's infection, something like the next generation urine test is going to tell you what will kill it. And so I wouldn't hesitate to do that. I think that is a critically important piece of data for you. It's useful information that will either rule in or rule out bacterial infection. But I also think a visual examination of your skin would be meaningful down there. If you're dry externally, the odds are you're dry internally. And then eventually giving them an opportunity to look in the bladder to see if there's anything dysfunctional happening in there, whether it be bladder stones floating around in your urine or something funky with your bladder wall. It's time. It's time for data. You get what I'm saying? It's time for data.
Yeah.
It's time to stop guessing. Guessing is getting you nowhere. Now we need some facts. And, you know, it's hard when you're suffering. It's hard when you're scared. You're scared. I know you're scared because I was scared too. It's really about just making a checklist of things we just want to rule out and just doing them one at a time. So tomorrow I want you to call your OBGYN or your primary care, whoever you can get into first, and just have them look at your skin and just we need some concrete answers now. Okay?
Yeah. Unfortunately, here in the UK, the getting help is not as straightforward as it's in USA.
I know.
Because you have to wait through quite a long waiting list. First, we need to visit our primary healthcare settings.
Yes.
And then they will make a referral to the hospital specialist, urologist.
Mm-hmm.
Then that process is not straightforward. That process is, at least it takes 2 to 3 months to get to see a urologist.
Mm-hmm.
I'm happy to pay for private, but as long as it's safe, Jill, I'm really scared at the moment. Whenever when I'm stressed, it gets even worse. The symptoms get even triple.
Sure.
It's really worse. And most of the time I'm scared. Most of the time I'm stressed. And unfortunately, I don't have only the stress of my health. I'm in a full-time education as well. Currently, I'm training to become a midwife. Mm-hmm. So that also triggers all my stress. At some point, I'm thinking I finished already. It's 18 months program for me. I finished 1 year and it's just 18 months left. And I'm thinking if I leave my education, all my money that I've already paid the jail, it's gonna waste it. So that kind of thing makes me to think about myself, think about my future. Honestly, I just want to give up everything and just, I don't know, concentrate on my health. I don't know.
Well, I know. Well, okay. Now listen here. Now listen. You of anybody is perfectly positioned to navigate through this thing because you are in training to be a midwife and a nurse. You understand the biology. You understand. So you have the background, the expertise, the knowledge to understand how your body works. And that already puts you far ahead of so many other patients who just don't understand basic anatomy. You get it. And so I think number one, I was just looking on my Twitter page because you're in school. You're trying to get a hard specialty, being a midwife. The stress is undeniable. Throw in COVID, and there is no doubt that the entire world right now is under stress, and you are under an extra level of stress because you are in school, and potentially being in healthcare, you're also seeing all the COVID warnings, which would only amp it up. I mean, there's just no doubt about that. And we have to understand the impact of stress on the human body. When you're under stress, you're going to be tightening your pelvic floor muscles, and it's going to be sensitizing your nerves. And you know this because when you're working with women having babies, what are you having them do? You're having them deep breathe. You're having them get back to very simple, minute by minute, hour by hour. Let's take a deep breath in, out, trying to keep that body relaxed. You now get to practice what you preach. We've got to get your stress level under control, and we've got to improve your stress skills, right? Because you're a teacher. You're going to be, everything you learn now, you're going to be passing along to the hundreds of moms that you're going to help have babies, because I have no doubt you're going to be a fantastic midwife, not only for your training, but because of the compassion that this entire experience is teaching you. You know, when I see happen to me, and I went through this pain and I did my reckoning with God about why me, why now? Why me? For God's sake, I just want to get married and have babies. Why are you making me go through this? Right? And the only way, the answer that came to me is that I was supposed to do something with it. That there was something that only I could do, that I needed to do. And I feel very deeply that's one of the reasons why it happened to me. I will tell you, it's me. Going through this experience, I'm a better person. I'm a more compassionate person. I'm a more dedicated person. I care for others deeply. Before it happened, I didn't. I was just in my own world. But once you have gone through the experience of extreme trauma, fighting for your life, trying to regain your health, a whole new world opens up. And it's not a world we necessarily wanted to be in, but we're here, and there's a reason why. And I will tell you, I believe that this will make you a better midwife for the experience. And I think one of the first things, in addition to trying to solve the anatomical mystery of what the hell is happening in your bladder, the other thing that is clearly coming to mind right now is, God didn't give you the skills to deal with COVID when you were born. You have to learn them. Stress management, some basic, simple stress management skills that will help give you more control during the day and more strength and more confidence during the day, I think would be very, very helpful right now. Whether it is taking 15 minutes out of the day to, in fact, a friend of mine yesterday posted, she's going through a divorce right now, and her child was born with heart problems, and her life has been hell for the last 4 years. And she just admitted her anger. She is so angry. She is so physically angry and emotionally angry. She is yelling at everyone. She knows it, and she doesn't know what to do about it. And this is a good woman. And I talked about skill building, hon. God didn't give you the skills to deal with having a child born with a heart problem. We got to get your skills up here. I took an anxiety management class that completely changed my life. It's called Phobies. Go over to our website, watch the anxiety and IC video. That might help you tremendously, just doing the little routine that I do now when I'm under stress. But there's no shame, there's no blame here in any way, shape, or form. Nobody's saying you did this. Nobody's saying you caused it. Nothing like that. This is it. It's a mystery that we've got to solve. Does that make sense? She may have. I hope that made sense, kind of, sort of. Catalina says yes. Okay, hon. Listen, if you ever want to talk to me, pop me an email, icnetwork@mac.com. If you want to prep for that appointment, I would be more than happy to help you prep for that appointment. And so that you can walk in with some really good questions to ask the doctor, et cetera, et cetera. But I don't want you to feel like you're damaged goods. I don't want you to feel like this is your fault in any way, shape, or form. Something happened to you. We have to figure out what the hell happened to your urinary tract. And at the same time, we all have to respect the fact that we are all struggling terribly with stress right now. It's a terrible time in our world history. And it's overwhelming, and we're all angry, and we're all feeling frustrated. And so let's see what we can do to kind of let some of that anger and let some of that stress out, so that it's not making you tighten your muscles and all the other stuff that would do that. So, all right, hon. I can't see you, but I'm giving you a big giant hug, okay? A big, big, big giant hug. Okay. Let us go.
On my camera, I don't know why my camera is not getting on. I think I need to go to my setting. Honestly, during COVID, I was working in the hospital and I got COVID. I had symptoms. So I had a fear that if I get it, I would definitely die because of my immune system and because of my eating. So I don't know how I survived. And 2 months later, I did an antibody test and it came up positive that I got it. I don't know how my body fight back this infection because it was this virus, and I had 40-degree temperature. I thought I'm gonna die.
Right.
Because I was in placement at the time, and it was March. Yeah, around that time, UK was really bad.
Okay, but hon, I want to turn this around. Your body was strong enough to survive COVID. Embrace the strength. Embrace the strength. So you're a hell of a lot stronger than you think you are.
Trust me, I think if it was somebody else, it would have given up everything, all the study, the career, everything. I don't know how I'm going. Keep going. I don't know what.
Hey man, listen. If you got through COVID, you can get through this. We just do it. Okay. I mean, seriously, there's a test of tests right there. Okay, hon, listen.
So much.
I've got to move on. I got to move on to somebody else, but I hope you'll keep in touch with me. My email address is ICNetwork.
Definitely. Let me write down your email before you go.
Okay.
I need to go as well because I'm working tomorrow and I need to wake up at 6 o'clock. It's already 13 past 11.
Okay. So my email address, are you ready?
Yes.
ICNetwork@mac.com. ICNetwork@mac.com. Now listen, I'm giving you very, very specific homework. Your homework is when you wake up in the morning, as you're putting your clothes on, I want you to say, I am strong, I am confident, I am smart, I am a survivor, I will get through this. I want you.
Thank you so much,
girl.
Honestly, when I come to USA, I will definitely visit you.
Okay.
Definitely.
Okay, but I want you to say that every day, several times a day. I am strong. I am confident. I am informed. I am knowledgeable. I am a survivor. I will get through this. I want you to say that to yourself over and over and over and over and over for the next 6 months, because I want to turn, listen, if you're focusing on the negative, on how am I going to make through this, you're giving your brain something that you don't want it to focus on, which is not surviving. I want you to focus instead on, I survived COVID. I have gotten through this. I am going to figure this out. I am walking strong, confident, informed. I'm going to work with my doctors. I'm taking control because I'm going to learn from this, because I'm going to help thousands of other women go through this too when I care for them. That's what I want you to say to yourself every single day, okay?
Thank you so much. I will definitely, and thanks for your encouragement. I'll definitely keep in touch with you, definitely. And thanks, because of you, I'm getting back my confidence. Otherwise, I lost everything that I should, I was really in a deep depression.
Okay.
Because of my flare up, and even I've got flare up, and tomorrow I'm going back to my place, and I've got 2 long days tomorrow and the day after tomorrow. But your encouragement, gives me more confidence.
And start making notes. And hon, listen, I want you to start making notes about coping mechanisms, because what you're going through now is teaching you really important life lessons about what works and what doesn't work when it comes to stress management. And you're going to need to come back to these when you write your book on how to handle stress management, how you're going to help women with risky pregnancies handle stress management as they approach childbirth, right? And so I want you to really start making notes. Think that you're writing a book. Write the good stuff, write the bad stuff. Focus on the highlights, what's working. Okay? And I'm telling you, listen, you come to me 3 months from now, we'll write a kick-ass article together about stress management and IC, okay?
Definitely.
Okay. All right, hon. Nice talking with you. Okay.
Me too. My name is Suzanne. Sorry, I tried to put my name. It didn't even come up. I don't know why.
Well,
I'll try for next time. I'll try to fix my camera and put my name so you know my name as well. My name is Suzanne. It's actually Susan, but you can call me Suzanne. I don't mind.
Okay, sounds good. All right, hun. All right, let's go to Linda. And you guys, don't take it personally if I'm just randomly picking people at this point in time. Christy on Facebook says stress management is here. Right, guys? Seriously? And the power of affirmations. Do not ignore the power of affirmations. When pain is accompanied by positivity, your brain will minimize that pain. If pain is accompanied by catastrophizing and anxiety, your brain is going to intensify that pain. Your personal skills matter. Okay, so Linda, how are you doing today, hon?
I'm doing okay. I think I told you last week, the acupuncture doctor that I've been seeing the last 3 weeks has me taking 1,000 milligrams of fish oil twice a day.
Okay.
I've never heard that before. I don't know if you've had it on here before, but it has curbed the burning pain in my bladder. And I wasn't sure how the acupuncture worked other than on the nerves. And I asked him when I went last, because I thought it would just be blocking the pain. Because I think I also told you that I had a hydrodistension in May, and this is the first time it didn't help. And anyway, I started doing the acupuncture, and he was saying that the acupuncture lets the blood increase in the area, and that helps the inflammation.
Right.
So you're verifying that is how
that's
that
true.
Works.
Yeah, that's true. That's why acupuncture is listed as a step 1 treatment option in the AUA IC guidelines. There's no harm in it. If it makes you feel better, then power to you. But the question from last week was, does your fish oil have lemon in it?
No.
Okay, good. That's good. So we can at least rule out that superficial irritation from lemon juice. So that's very, very good.
That's funny because the second time I went in, he said I looked pale. I don't know where that came from, but he told me to take zinc. And I bought the zinc from his office. And when I got it home, it says zinc with lemon. So I wasn't, they're lozenges. He was saying to keep up my immune during this COVID time. And I didn't take them at first, but now I'm dropping them every now and then. I don't think that they're affecting me, but I was hesitant because anything that has lemon, I usually back off of.
Okay. Well, this is one of the situations where trying a small amount, seeing how you do would be reasonable, right? When we're talking about here, and I apologize. Somebody just totally distracted me. So we're talking about magnesium or zinc? Zinc. Yeah. And you're saying that it had vitamin C in it? Say that again. I'm sorry.
Yeah.
Let me just...
The jar of zinc says with lemon.
The jar of zinc says it has lemon in it.
Yeah, let me see if I can...
Lisa, thank you for your patience, hon.
It's a zinc lozenge, and it says vitamin C 60 milligrams, and the zinc is 15 milligrams. And then it has slippery elm bark powder, 25 milligrams, and B.
And have you taken it yet?
I've taken it a couple times. The acupuncture doctor that I'm going to is East-West. It's backwards. East-West medicine.
Okay.
So he said he was a urologist, studied urology before he switched to acupuncture.
Okay. Okay. Well, ultimately, in the end, it's not only about treating the symptoms you're having today, it's about trying to understand the underlying anatomy, right? And that is, what is it in your pelvis that is driving your discomfort and pain?
A lot of the stuff that you talked about today with the fascia,
Mm.
I mean, I know the fascia goes all over the body and holds everything together.
Right.
But today you mentioned about the feet and mentioned even for the jaw, because I know I clench at night, and I realized I was doing that during a flare. When I wasn't clenching, I was clear, but when I was clenching, it was during a flare. Well, now it's ongoing, and the physical therapy didn't help that much. But now I've been going to physical therapy for my hip, and on one of these sites, I don't remember how many meetings I've watched now, you were mentioning the hip area, pulling the ligaments, or how the bladder is tied up
Right.
in our pelvic area, that my hip pain might be related to my bladder, because I didn't have any trauma to my hip. And this is going back 5 years when I first started getting the pain, and it's been off and on. And then the physical therapy has been helpful, but I'm still getting the pain. And now I'm wondering if it's, from learning, maybe it is associated to my bladder.
Well, they're all connected. And I think you as a patient have to explore every avenue that's available to you. And if you have had long-term consistent hip pain, then we have to understand what that's all about and how that potentially is going to be influencing your other pelvic organs, because it is influencing your other pelvic organs. There's no doubt about that. So do you have arthritis in the hip? Do you have an SI dysfunction? Do we know what's wrong with your hip?
No, when I went to the doctor first in February, because she had ordered an X-ray 5 years ago, but the X-ray doesn't show anything. And when I went back in February, I told her, like, when I go on my walks, it feels like a rubber band snapping against the T-band area of my hip. And so she ordered for me to see a sports medicine doctor.
Good. That's great.
The COVID kicked in.
Yeah.
And the authorization didn't go to the right doctor. And so now I do have an appointment next week to see a sports doctor.
Good. I think that's really what helped me understand my constant left side pain, because I have had left side pain for 20 years, 18 years, and that just worsened over time. And it was just SI issues combined with muscles and ligaments. I was doing exactly what I shouldn't have been doing. They kept telling me I needed to stretch the muscle, that it was a tight muscle, and it wasn't a tight muscle. It was a muscle that was compensating for a very loose joint. And it's a sports injury. And so I think going to a sports medicine doctor is great. So let's see what they find. And again, maybe when you walk in, really focus your ability to describe your symptoms and the sensations you're feeling in your hip is really critical here, because it could be a ligament, it could be a tendon, it could be a muscle, or it could be something else. So try to make a list of the symptoms that you're having so that when you get there, you can just read them off. The snapping, like sometimes for me, when my pelvic floor gets really, really tight, my thigh muscle snaps over the top of my hip bone. I get this snapping sensation in the front of my leg. And it's the muscle snapping over something, which tells me that my muscle is really, really tight. So just try to make those down and then report back and let us know what they find, okay? All right, hon. Nice talking with you. I'm going to go to Lisa. So here, hold on a sec. Hello, my friend. See, I am embodying my athletic nature with an athletic shirt, even though I am not being athletic today. I am sitting here.
I have my
Oh, I love it.
social distancing shirt on.
Well, we are practicing the ultimate in social distancing. How are you today? How are you feeling?
I've been social distancing now for 4 months.
Okay.
It's depressing, you know.
Ugh.
I live alone 24/7. It's kind of, yeah, I don't almost ever go out. So, but I miss exercise most of all.
Yeah.
I just bought a brand new set of golf clubs in February and I haven't even used them. And I'm just, whoops, what did I do?
Nothing. You're
messed up
fine.
the view.
I can see
I
you.
just don't want to take, because of my age, I just don't want to take the risk of going, even to hit golf, even to the driving range, or, you know, my tennis coach has a couple outdoor courts at his apartment. He said, I'll come over for an early lesson. And I just
Well,
can't bring myself to it.
if Texas were on the decline, it would make sense, but you are on the
It would be
incline.
difficult.
So you are making the right decision right now, but
Yeah.
you know,
And
and
you know what? It's not, I mean, our governor obviously doesn't help,
no.
but one of my girlfriends was driving home last night from something, and she lives near me, and she said she passed 3 different bars in our neighborhood that were just overflowing out into the street
Oh God.
of people partying. And it's like, you know, I don't know. What do you do with these? I mean, my girlfriends were just all texting like, when you were that age, would you have stayed home? Would you have been out drinking? And I said, you know, I was a big party girl back then, but I've asked myself many times, and I honestly don't know what I would have done.
Well,
But I love your earrings. My IC is doing still good. My colitis, not good today. You can see I'm on the couch. I mean, I just gave myself permission to be on the couch for the day. So,
okay.
but I just like to hear the people talk because I learn a lot from them. But so what do the people who are still logged in on YouTube and Facebook, YouTube and Facebook, are they listen? Do they see you? Do they hear the two-sided conversation?
They see me and they hear the
Yeah.
conversation, and there's 11 people on YouTube and there's about 30 people on Facebook.
So do they hear both sides of the conversation?
Yeah. Yeah, because I'm
Okay.
playing it so that it can be picked up by my microphone.
Okay. I wonder why more people don't get on the Zoom call.
I haven't been very good at advertising it yet. I've been very, very preoccupied with stuff myself. And if we weren't dealing with COVID and all the other stuff going on, I think we'd be doing a lot more. But
Yeah.
I mean, I'm way behind on newsletters and everything. It'll happen. I'm not worried about
Honestly, if it weren't for Zoom, I would be so totally isolated.
Mm-hmm.
That, I mean, I Zoom with my girlfriends, I Zoom with my family, I Zoom my piano lesson, I Zoom my harp lesson, I Zoom my yoga, I Zoom my exercise. I mean, Zoom,
yeah, but okay, but here's what you're not doing. You're competitive like I am. Are you playing any online games?
Well, I downloaded Fortnite. I don't play that. I play stupid games like Cookie Jam and Toy Blast.
If you go to twitch.com, there's this really robust community of gamers that's like Zoom, where you can go into their chats and hang out, and it's like bringing a whole group of people into your home, and it really breaks the isolation.
I have noticed that, like, people who have, I think people are like trolling, you know, all these weird people have gotten on LinkedIn and stuff and asked to be my friend. And I'm like, I don't want to be your friend. You know, I'm not gonna accept that. I mean, on LinkedIn and on what do you call the other one? How can I not think? Facebook. You know, it's like, who are you even? I don't even know who you are. So it's crazy. But anyway, but I listen to people because you know how much I suffered. My IC has been weird because I had it horrible for a year. And then it went away for 15 years.
Right.
And then I had it horrible for a year.
Mm-hmm.
And now it's kind of been gone for the past, say, 6 months. So it just kind of like comes and goes. I
Well,
don't know why. I don't know why. So,
well, we're getting there in the end. I invite you to come over to Twitch and hang out. I'm going to start an IC Twitch channel too.
okay.
Rather
I
than
think I donated the Twitch app, but
Twitch is fun. It's fun. So anyway, well, listen, nice to see you. I'm going to shut down the Zoom and I'm going to go back to Facebook and YouTube for maybe another half hour. Okay.
okay.
Okay. See you guys
Bye,
later. Thank you for coming. Oh,
Bye.
wait, hold on. Mickey, wait. Somebody's trying to get in. Hold on. Mickey, are you there? Hold on. Hi, Mickey.
She's connecting.
Testing 1, 2, 3. Mickey, can you say something? Because you're not muted. Can't hear you. Your audio, Mickey, I don't know if you can hear me, but you weren't showing any audio. Do you have a headset or anything plugged in? You need to check your audio settings because as I look at your setting in Zoom, you don't have any audio enabled. Say something. Nope. She's gone. Let's give her another minute. Let me go back to Facebook here. Marianne says, I've been drinking a vitamin C supplement for the past 2 weeks, and I bet, girl, what the hell are you doing drinking a vitamin C supplement? You can't do vitamin C supplements when you've got IC. No. Hell to the no, and no, never again, no. Lisa says, are no vitamins recommended if you have IC? No, that's not true. But we need to do low acid vitamins. So the vitamin that you can do is this one. Whoops. Oh gosh. Now, yeah. Now y'all know it's not a support group meeting if something doesn't fall. Hopefully that's not me. Bladder Smart. Okay, I'm going to try to let Mickey in again. All right, so the Bladder Smart low acid vitamin is indeed a vitamin that is much more bladder friendly that might work for you. So Mickey, it's giving me an error. It's saying it's connecting to audio and can't hear you yet. Oh, there you go. Now it says you're connected. Okay, you're going to be our last person on Zoom. Can you say something and let's see if it works? You got nothing. No. Do you have a microphone in? All right, I'm going back to Facebook while she's figuring that out. So, Lisa, the challenge would be, yes, I can. So hang tight there for a moment. Let me just go to Lisa. So B6 is one of the, so vitamin C is the most irritating vitamin by far. Ascorbic acid derived from citrus, well known to be an irritant to a tender, vulnerable bladder. B6 has also been reported to be irritating to a lesser extent, but potentially irritating if you, as a supplement. But if you take foods that are high in B6, it might be more tolerable. But ultimately, in the end, Lisa, it's about what works for you. And again, doing a low acid vitamin supplement would be, because this does have, no, you know what? We took the B6 out of this. Okay, I'm wrong. Okay. Well, anyway, it does have vitamin C in the form of calcium ascorbate, but they took the B6 out of this. So you would still need the B6 supplement. But anyway, guys, this is a supplement that I take for a vitamin several times a week. It's never irritated my bladder. I take it right before bed. We discontinued Multi-Right, which was that big horse pill of a low acid vitamin, because it was just too hard to swallow. So, all right. So let us come back now to Zoom. All right, hon. Okay, now I've just lost your name.
Mickey.
Mickey, how are you today? How is life treating you?
Well, I've been going through a lot because I got pneumonia like 4 months ago, and I was on the COVID floor, but they figured it out finally after 5 tests that I didn't have COVID, but they had to put me on prednisone because my lungs won't open up, and it's like affecting my bladder
Oh my God.
and my mood. I'm like real aggressive.
Okay.
So then my doctors put me on Klonopin to like calm me down.
Okay.
I'm just like real revved up constantly.
Hmm.
So, which has entailed a flare. So I had a Zoom meeting with my urologist, and he was saying that that I should try the InterStim, and I just want to know what your thoughts are on the InterStim.
Well, tell me about your history. How long have you had IC?
Probably 35 years.
Okay. Okay. And so okay, say that again.
We're at the end of the road.
We're at the end of the road. So do you have Hunter's lesions?
Yes.
Okay.
And I did get that book that you recommended.
Okay.
The chronic pelvic one.
Yes.
And I showed him that, and I think he might even have that book, but he thinks that but I had texted you that I cannot handle the zap of a TENS unit. I'm too sensitive for it.
Okay. Okay. So again, I just want to try to understand anatomy before we can talk about therapies a little bit.
Mm-hmm.
So how old are you now?
I'm 60. I'll be 63 on Wednesday.
Oh, congratulations. Happy birthday.
Thank you.
And birthdays are weird right now because we're home, but you know, it is what it is. I just had mine last weekend. So your symptoms began in your 30s, like mine did.
Yeah.
And did you associate any event with the onset of your symptoms?
Well, I think I had told you the last time it had to do with them with my second daughter, giving birth to my second daughter.
Okay.
My placenta didn't come out, so they pour it out of me.
Oh God. Mm-hmm.
No, I had all my kids natural, so I think that's kind of. And then I know that my grandmother had her uterus fell out, so I think it's like genetic also.
Well, a prolapse is because of weak muscles. That's not genetic. I'm not aware of any genetics associated with prolapses. That just means muscles are injured and dysfunctional. So when they pulled the placenta out of your body, what kind of damage did that do?
Well, I started to have a pinched nerve in my tailbone.
Okay.
Then I went.
How did they do it?
I don't really remember. All I know is they put leather straps in my hands, and I have a picture of the doctor. He's bloody all the way up to his wrist, up inside of me, pulling my placenta out. So
holy crap!
It was. That's the only thing I could think of. And then I have broken my tailbone when they put me. When my first urologist put me on that nerve gabapentin, and that made me faint. And then I fell and broke my tailbone from that.
Okay. So you really are, again, a surgical injury patient. You are an injury patient. Right. Whether it was damage done from them pulling the placenta out of your body or damage done when you fell on your tailbone, there's no doubt you sustained some sort of injury, in all likelihood a neurological injury. And so let's talk about neuromodulation for a moment. So, and here, hold on a sec. I broke my rule about never eating when I'm on stream, but I had to have a little bit of coconut. Now it's in my mouth. So neuromodulation acts to kind of normalize or re-regulate nerves that are dysfunctional. So the theory behind neuromodulation is that if you stimulate them with a stimulator unit, like a TENS unit, that you are kind of teaching that muscle how to be, that nerve how to be normal again. I mean, there's a much more scientific explanation for it, but that's kind of the theory behind it, is that there's nerve dysfunction. And when you use a stimulator, it's kind of like a pacemaker in a way, you know, where a pacemaker normalizes. So it's trying to normalize nerve function. There are 4 different forms at this point in time of neuromodulation. There is interstim, which involves implanting surgically both a stimulator and a lead at your sacrum, and then a stimulator in your butt in some way.
Right.
Obviously, that requires at a minimum 2 distinct surgeries: surgery to do the trial, and then surgery to do the implant. There is another nerve that they can do rather than sacral neuromodulation. They can do pudendal neuromodulation, which has been found to be helpful in some patients. But again, we're looking at the challenges of surgery. There is also post-tibial nerve stimulation, which is done at the ankle. So it's a very, very interesting history, because
my insurance won't cover the one on my ankle.
Well, but let me finish what I'm saying here for a moment.
Okay.
They were both developed at UC San Francisco. Interstim sacral neuromodulation was developed by Dr. Tanago and Dr. Schmidt. And it was, and I know this because I was referred to UC San Francisco when they were doing it. So they had their early interstim days. And I will tell you, the patient trauma that happened in that group was nothing short of astonishing. They weren't using anesthesia to do leads. Leads were moving, leads were falling out. I ran the support group for Northern California. I had a ton of those early interstim patients in my support group meeting. And believe me, there were very, very, very few success stories. These patients were terribly traumatized by in those early days. One story was a young man with IC who was there with his mom, and he must have been 18, 19, 20 years old, something like that. And the doctor said, yeah, let's do interstim today. And he looks at his mom. He's like, okay. Doctor goes, yeah, it's a piece of cake. Mom goes out in the waiting room. She hears her son screaming, help, help, because they didn't use any anesthesia. And the suffering that he went through, and thousands of patients or hundreds of patients went through, is nothing short of astonishing. And eventually, Dr. Schmidt was asked to leave UC San Francisco.
Oh, wow.
And he went to University of Colorado, and University of Colorado to continue his quote unquote research. Within a year, the university tried to fire him for medical questionable stuff going on. And he successfully defeated their termination by saying, you can't fire me if you never gave me standards to move through. So they agreed to pay him for another year out of their litigation avoidance fund. They convened a second panel of his peers. They also recommended that he be terminated, and he was indeed terminated. And there were a dozen lawsuits filed against him and the university for these devices. Okay, now, Urgent PC, ankle PC, was developed by Marshall Staller in response to the horror of the interstim, the early days of interstim. Marshall Staller, who was my doctor, praise God, hallelujah, he said, guys, you don't need to operate on these people when the same nerve is right by the ankle, about a half an inch below the ankle of the surface. You can use a damn acupuncture needle and get to the exact same nerve. And he proved it, and he did the research study. And now ankle stimulation And interestingly, they both use the same benchmark. You know that the ankle stimulation nerves are placed correctly if the big toe flexes down or the little toes splay out, right? And when you're asleep, having the interstim put in, they're looking for the same foot reaction. That's how they know. The question is side effects, because they're both approved. They're both approved by Medicare. The challenge with interstim is that there are thousands of serious adverse events that have been filed with the FDA. I mean, thousands. And you know what? I'm going to do screen share with you right now. Hold on. You can see my desktop right now, right?
No.
Here you go. Hold on. All right. So now you can see the owl? Okay. So this is what I'm going to do. I'm going to Google search for the FDA MOD database. Okay.
Okay.
First link. So MOD stands for Manufacturer and User Facility Device Database. And this is where all of the adverse events are stored for various products. So look, so now we're on the database. I'm going to search under brand name Interstim. And I'm just going to change the date to, let's see.
Is it M-U-D or
No.
M-O-D?
M-A-U-D-E. Okay, so I'm going to do my search from January 2019 to today's date. Okay?
Okay.
Under the brand name Interstim. Here we go. 1, 2, 3, 4, 5, 6, 7, 8 adverse events reported on June 30th alone.
Oh, wow.
Oh, no, hun, there are thousands of these here. I mean, there are deaths. There are fatalities. Last time I counted it, there were about 20 fatalities. So here we go. Information was received from a friend or family member of a consumer with an implantable neurostimulator for incontinence. It was reported they had an implantable stimulator from a different manufacturer implanted, and it was interfering with their urinary stuff. Patient services. Okay, well, this isn't weird. This is weird. Anyway, let's try this again. Let's see. You just kind of have to. Sometimes there are duplicates. Now this one, okay. Okay, that one's hard to understand. You just kind of have to go through these. Okay. Here we go. Information was received from a patient who received an implantable stimulator for urinary dysfunction, sacral nerve stimulation, pelvic floor. It was reported that the patient is having a terrible time. She had to go to the toilet 15 times for the last hour because it's stimulating her to go. She can feel it fluttering in her left labia. She's also in terrible pain from the surgery, but she got some pain medicine for that. Patient stated that frequent urination started this afternoon. She kept catheterizing, which she does 8 to 10 times a day, and is peeing in between. Patient indicated her frequency is worse than it previously was, and she would like to turn the therapy off for the time being. Patient turned the therapy off. There were no device issues reported. Okay. So, you know.
I think you convinced me.
Well,
my urethra is so deformed from this, from the IC that they can't even catheterize me.
Well, but that's somebody who is catheterizing. I'm not saying that everybody has to be catheterized. What I'm saying is, here we go. Here's another one.
Well, when they shot Botox in me, they told me that I may have to catheterize myself, and I said,
yeah, that's not the right therapy.
But anyway, I've been looking around like on YouTube, and I just haven't been able to find anything on people that have had Interstim.
Well, hon, we have a whole in our support forum. We have four discussions boards dedicated to neuromodulation. We've got Considering It, trying it, success stories, and failures. And you just
Okay.
literally have to spend a couple of hours and go
Okay.
through all of these adverse events, because there are hundreds and hundreds and hundreds of them. The most common one,
Well, thank you.
yeah, the most common one is deep tissue MRSA infection. So you get a MRSA infection.
Oh my God.
And here we go. Here's one. Consumer reported patient who was implanted, fell a couple of times, and now yesterday and the day before, her device is sticking out. It was okay. I mean, so listen.
I'm so glad that I talked to you, because, and I just happened to catch you, because I've got my doctor pressuring me and my urologist pressuring me to get this thing, to do the trial run. And so I'm just glad I was able to catch you. So I'll do research.
Okay, so here's the other thing. Here's another. So again, go to our website, look at our support forum, and go into the areas on neuromodulation. Now let's talk turkey about this for a moment. Now, ultimately, you have to understand that this is a money-making opportunity for doctors.
Oh.
And one of the reasons why the IC network even started selling supplements was because there were doctors throughout the United States. There's one in Colorado, not the guy who invented another one, who basically turned their clinics into InterStim factories. And they started telling patients there were no other treatments for IC, just InterStim. Wouldn't even tell them about diet. And then these patients found us and found the IC network, learned about diet, learned about Elmeron, learned about all these therapies. And they were stunned. They felt that they were deliberately misled to have a surgery. And it's not just one surgery, it's potentially 3 surgeries. Implant, and even more. Implant trial, implant, having the battery maintained if necessary, and if everything fails, having everything removed. That's potentially 4 or more surgeries.
Well, and then the anesthesia throws my bladder into a flare too.
Well, so InterStim has a place. It can change your life if you're incontinent. Listen, if you were fecally incontinent,
I'm not incontinent.
I know, but what I'm not saying it's terrible. I'm saying it has a place, when we have to be knowledgeable about it. We have to understand the risk versus the benefits. But so in addition to the side effects, the other critical issue is money. And I want to tell you the story, a true story of a nurse who was forced to have it. She had 3, kind of like you, she had 3 urologists in her small town. They all said, you have to have InterStim, you all have to have InterStim. They wouldn't do anything else. They just drew the line. And she said, okay, it's like, all right, if this is what you say I have to do, this is what I have to do. But she was smart. And so in the sense that she because she was a nurse at the hospital, she wasn't a fool. So she started making phone calls. So she talked to the billing office in her doctor's office and said, is this covered by my insurance? And they said, absolutely yes. No pre-written authorization is required. She's like, okay. Then she called the hospital that would do the surgery, talked to their billing office. Is this covered by my insurance? They said, absolutely. No written pre-authorization is required. You are home free. Then she called the insurance company and asked them, is this covered? And they said, absolutely, you are fine. No written pre-authorization is required. So she agreed to do it. A week after surgery, she got a bill for $80,000. Guess what?
God.
They didn't authorize it. And they garnished her wages.
That's horrible.
And the mistake she made is she didn't get it in writing. And so I would, if you are considering it, you got to get but get everything in writing. And
he's been pecking at me for 2 years now to do it, and I'm just not going to do it.
Well, but so the ankle stem, if you go back to the MOD database and you look up urgent PC, there's like 2, and they were just for tingling in the feet. You can say, hey man, I'm open to ankle stem, but I do not want to have surgery right now. I would like to try the easier form of neuromodulation first, which is urgent PC, which has all the same approvals as InterStim, but will cost me less money. And if he says, well, I don't do it, then you're going to say, all right, can we call the company and maybe get a training for it? Or maybe the company can refer me to somebody else who can do it. Because the ankle stim is a piece of cake. I mean, you just go in, you sit.
A few times before my insurance kicked me off it, but I started a new pain clinic with acupuncture and a naturopath through Providence on my birthday.
Okay.
So I'll see if they can maybe work on my bladder meridian. But thank you for the input, dear.
So SP6 is the acupuncture point that you're looking for above the ankle. Okay. And with the guy who invented it before, because Urgent PC is another company, the guy who invented it, he taught us. He gave us a tattoo on our ankle. He told us where to put the needle. He taught us how to put the needle in.
Really?
And we had the TENS unit and we did it at home. I still have my tattoos. Oh, wow. I mean, see? You see that little black spot right there?
Uh-huh.
That's my tattoo for the ankle stim right there. And you'll see, look, it's 3 fingers. It's 3 fingers above the ankle point. So look, here's the center point, right? Right here.
Uh-huh.
So let's see. Well, I don't know. Let me see if I can do this. So look, there is the center line. I don't know if you can see where I just did it. And the SP6, now mine has moved a little bit, is like right here.
Okay.
And so it's 3 fingers above here, and it's about 1 finger below center. And then there's a trick to putting the needle in. You don't just put it straight in. You kind of have to drop it down into anyway, there's a little trick. So potentially you could even go to an acupuncturist who might even be able to teach you how to do it. Okay. I don't know. I mean, that's the way they did it.
Do that at the pain clinic. So because the physical therapy, when she would go inside my vagina, just is too painful.
But yeah, it's too painful at this point, but that is the end goal. The fact that it's painful is critically important because that tells us where your problem is, right? And so you shouldn't.
And it's on the left side, and my left thigh always hurts.
Your left thigh always hurts. So what about going to a sports physical therapist and having him try to figure out why your left side always hurts?
Okay.
You got to do that.
Okay. I will,
whenever a quote unquote IC patient can point to a point, a location, it always hurts here. It's like, that's actually not consistent with IC. People with a typical bladder injury, you're not going to see pain on the left side or pain on the right side. Their pain is very centered. So the fact that you have pain always on the left side and you have a painful thigh points to an orthopedic issue. And you need to get that explored and see if there's anything going on with that.
Well, I was jogging like probably 5 miles a day. And then all of a sudden I fractured from going up and down off the sidewalks. I fractured my pelvis in 2 places. And they told me I had an inguinal hernia. And so then they had to do a CAT scan because I couldn't even get up out of bed to pee. I had to in a bowl. Anyway, and then so now one leg is shorter than the other.
Well, so okay. So what are you doing about that? Do you have
I've got sandals on right now, but when I have shoes, I wear a little thing in my shoe.
Yeah. So you've got things to explore here. And so the question, and getting back to InterStim, is InterStim going to help something driven by one leg longer than the other? I don't know. That's a good question.
I can't go through it, but I'm just glad that I caught you, and I appreciate your input, hon.
Well, and again, I'm not saying InterStim is a bad therapy. I'm saying that InterStim is something you got to have your eyes wide open, understand the risks versus the benefits, and learn from all the other patients who are doing it, because a lot regret it, but a lot find, I'm not going to say a lot, some patients find it helpful, but quite a few patients really regret ever having it done. Okay. So, all right, hon, I'm going to shut down. I'm going to shut down Zoom. Keep in touch. And remember, you know, my job here is to educate you and then kick you in the butt, get you back to the doctor to ask good questions.
All right.
So
Thank you.
For anybody watching, please do not think I'm not in the business of giving you medical advice. I'm in the business of educating you and then getting you back to your doctor so that you can have a better discussion with them about what's going on. Right? Right. Okay.
Awesome.
Bye,
All right.
Nikki.
Thank you. Bye, Jill.
All right. The Zoom meeting is shut down. All right. All right, my friends, we are back on YouTube. And well, we've always been here, but I am now back looking at you guys. Woo, look at how good you guys are. So Marianne was drinking vitamin C and she had a wicked flare. She said, I was trying to boost my immune system because I'm a teacher and our school is talking about face-to-face classes. Oh, honey, my mom is a teacher. My mom is a retired teacher. And I asked her last night, we sat down, it's like, would you, she taught 3rd grade. I said, would you go back to school? And she said, no. Marianne says, I want a smart bladder. Well, you can get Bladder Smart in our store. Just go to our website and click on the shop. I am really, really happy with this. Linda says, I've had a hard time trying to find B12, which milligram dose or which brand. I did Zip Fizz from Costco. It is an energy drink. I was hesitant because it has caffeine. The caffeine is from green tea, not coffee. Oh, so far I feel like it doesn't affect my IC. It sure helps me on days that I'm tired. Okay, well, hon, if that's working for you, great. But just know that green tea is a real strong irritant for most people, but maybe they took out the acid that would be irritating. But if you seem to be okay, power to you. Robin says, vitamin C buffered, but low dose multivitamins is a vague statement. Depends on what's in it. B6 is good for nerves. Yep. Lila says, I have a great truck with sublingual B12. Yep. Life right. Life right. All right, guys. Well, we've been going for 3.5 hours so far. So let's go ahead. Holly says she signed up for the magazine, but never got it. Can you read it online? Absolutely. You just need to log into your member page. You just go back to our store and log into your member page. And let me just do that for you right now. Listen, I've got screen share off, so y'all can't see all my top secret passwords here. Hold on a sec. Holly, I will check for you right now. Let's check it out. Let us see, let us see, let us see. There you are. I am not seeing a membership associated with your account, hun. Hold on, let me look in another way. Are you sure you're not confusing us with the ICA? Maybe you got something from them instead of us. So hold on, let me just check orders here real quick. I see something in March for $8. I don't think you signed up with us, hun. I've gone back to 2016 in our orders, and you've only placed one order with us, and that was for under $9. So just FYI. So maybe so I'm not quite sure what you're referring to. If you signed up for our free newsletter, that's another story. I sent one out last month, and I will be sending another one out again this week early. I'm not putting those. I decided not to store those on the website because there were a lot of old files in there that had old links. Ralph says, thank you for the back issues of the IC Optimist. All right, guys. So listen, I have got more back issues that I can send to people. If you would like a handful, 6, 7, 8 copies of our magazine, Old Back Issues, if you email me your snail mail address, I just need your mailing address, icnetwork@mac.com, icnetwork@mac.com, I will put together a kit of old magazines and new magazines from 2019 all the way back. And I'm more than happy to send you at no charge some of our old back issues because I really think that they're very, very good. All right, last call for questions. Last call for questions. Anyone? Anyone? All right, here's your homework. 15 minutes a day. 15 minutes a day. Do something for your spirit. Give yourself a little bit of peace. Go sit outside in the sun, take a walk out in the redwoods. If you have any near you, obviously social networking, distancing appropriate. Read your Bible if you're religious or whatever gives you comfort, do it. For 15 minutes a day, I need you to do something for your bladder, your pelvic floor. Do your exercises, my friend. They're important. For 15 minutes a day, I need you to do something to improve your knowledge. You got to improve your knowledge level here because, listen, you got to walk into the doctor's office prepared to direct your care. You are the boss. You pay them. They don't pay you. You need to walk into your doctor's office capable of discussing your symptoms and understanding your anatomy so that you can have a good discussion about it. And so at a minimum, it would be very important for you to if you can only get one book, please get this book, Breaking Through Chronic Pelvic Pain. It is fabulous. And it's free on Kindle Unlimited. Seriously, no excuses. If you're part of Kindle Unlimited, it's free. If you buy it on Kindle, it's $9. If you want the print version, which is what I have, and you can see my version, you can see all the notes I've made in it. This is a fabulous book. And then, of course, for 15 minutes a day, I want you to laugh because laughter helps your brain modulate pain. And pain that's accompanied by laughter is minimized. Pain that is accompanied by tears is intensified. So let us do everything we can to try to minimize that pain. All right, I'm going to call it here. Peace to everybody. I wish you well. If you found this helpful, please come on over to our website and think about becoming a member because that's what pays for this. All right? All right, guys. See you later. Have a good week. I will probably drop in sometime this week and do another one. Goodbye, Facebook. All right, YouTube. See you later, alligators.